desire to pledge allegiance on the Constitution Day? Was there somebody in charge of that? Okay, who wants to lead us off? Senator Hutchings. We got a flag over there. Today is Constitution Day. All right, lead us off, Senator. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, folks. Good reminder. Okay, we have on the agenda today some remainders from yesterday. Committee members, I hope you will all, when you have a question, try not to wrap it in 5 minutes of explanation before you get to the question today, so we can get home before midnight. That would be great. Senator Bouchard, I understand, has a carryover from yesterday. Go ahead, Senator.
Thank you, Madam Chairman. You know, these are a lot of the questions that we had yesterday on the vaccination
Is your speaker-
issues.
is your mic on?
A lot of the questions we had yesterday, and I would like to talk about a possible bill draft that we could do for the next meeting. And so it would be, and so I'll just go over it real quick because I understand the committee has a time constraint. COVID vaccination prohibitions would be what the bill draft would be. And section 1 would be public benefit contractors shall not coerce or otherwise make policy that forces anyone to vaccinate with COVID, mRNA or mRNA vaccinations if, 1, the public benefit, if a business is under contract to provide services, 2, if a private company providing services on public property, or 3, if a provider receives public funds in exchange for services. So that's kind of like the whole idea of what we do in health. We have providers that are using public like the hospitals. Those are all built on taxpayer money, bonds, and then we handed a contract over to another company. Discrimination, section 2, for the purposes of employment or housing. And I say housing because there have been issues now where they are actually trying to kick people out of their homes now if they're not vaccinated with this COVID. And then, by the way, this bill is all encompassing on just the COVID or mRNA technology. Now, I don't want to move into any other issues on vaccination. So shall not discriminate against anyone for absence of vaccination for COVID or any mRNA technology. Section 3 would be basically based on my original bill that I moved in the Senate. It was a simple bill. Government shall not coerce COVID vaccinations. And that's the language that's in that bill that 94, Senate File 94. And it's a simple bill that just says the government shall not coerce vaccination. There'd be a section 4 would be exemption protections. So medical animosity, medical exemptions shall be simple and signed by a licensed physician and have no questions violating doctor-patient privilege. Religious freedom, religious exemption shall be simple and not require questions about association. And then section 5, penalties, and I haven't come up with penalties, but I want to leave it open for the LSO 2 draft and try to put that in proper perspective. But penalties would be section 5. Violations under this act are punishable by fine, per occurrence, and class action is available as a relief. And then I'd like to do, and I don't have the definitions, but I want to focus this on mRNA technology. So I just have written down definitions are mRNA vaccination. So I'm trying to keep it in the scope of just what we're talking about. I don't want any arguments about polio vaccines or anything else. So
Point of order.
What's your point, Representative?
That seems like an inappropriate comment in the midst of presenting a adjusted bill draft.
Just carry on with the bill explanation, Senator.
that's it, actually the end of the bill draft. So I mean, I would like to motion to just draft this. It's not anybody making a bill today or talking, but just get a draft going so we can have these ideas to go forward on next.
Okay, so the senator's question is, would the committee like to have a bill along those lines drafted so that we can consider it at our November meeting? All in favor, please raise your hand just so I can see. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Also, we'll get with the senator and see what his ideas are. Okay, then we have up for this morning, the ARPA update. Have we got folks for that? Welcome back from 10 a.m. yesterday morning. So we're only, what does that add up to 22 and a half hours behind? Sorry about that.
Madam Chairman, members of the committee, Stefan Johansson with the Department of
Excuse
Health.
me, just a minute. Maybe I'm hearing a lot of conversation. I'm having a hard time hearing Mr. Johansson. Is there something that needs to be brought forward? Okay,
Thank
Go
you,
ahead.
Madam Chairman. I will be brief with my update on where we are with the Health and Human Services related ARPA funding discussions. We talked about some of these areas briefly yesterday. Just to give you a sense of the process, as you all know, the governor has received and is in the process of receiving an allocation of American Rescue Plan Act funds that ultimately will total just over $1.1 billion if memory serves.
and Stefan, let me just interrupt you for 1 second. Is there a something on this in one of your handouts from yesterday?
Madam Chairman, there is not.
Okay. Good.
Thank you, Madam Chairman. And so the process that has unfolded over the summer, as you all know, the governor has set up a team, both with his staff as well as several agency directors, including myself, Director Schmidt, Director Cooley with Workforce Services, and CEO Josh Durrell with the Business Council, to really be a team that not only reviews various proposals that are coming in for the use of ARPA funds, but also prioritizes those for governor's consideration. And then ultimately the governor will incorporate a subset of those proposals or requests that he believes are ready for investment in the short term for legislative consideration through the budget process. The way that this will work, my understanding is we will basically have two budget requests as we go into our hearings with the Appropriations Committee. One for the standard budget on the state side, kind of the normal process that we're all familiar with, and then a very similar parallel process with a specific budget request related to ARPA funding and ARPA proposals. So that process has been underway for a number of months. The governor's office and that team that I mentioned surveyed a wide array of stakeholders, including legislators, health providers, social services providers, members of the public, other stakeholders, including association members, and received a lot of feedback through that survey process on initial ideas for the spending of ARPA funds. And for myself and Director Schmidt at DFS, again, we are really focusing and in charge of looking at the health and human services related proposals. So that process has been going on. We anticipate that with the formal proposals we've received, as well as just the initial ideas that might warrant consolidation into certain topics to be fleshed out further over the months and even years to come, we will finish our priority list from that public process, from that engagement process by the early part of October, and be able to incorporate those things into the budget requests that I mentioned, that the governor's office and the governor will lead and submit with the normal budget in the normal timeframe in November. To give you all a sense, and certainly not final right now, of some of the areas, I won't go into all of them because we received hundreds of different ideas and proposals. But you may recall that over the first year of the pandemic, there were a lot of requests both from hospitals, other healthcare providers, for physical plant improvements, things like negative pressure rooms, isolation rooms, HVAC improvements, those types of things. Some of those projects were funded on the capital construction side by the CARES Act, and others weren't. So we did receive a lot of proposals or feedback to potentially use this funding source to continue those. That's one area in the healthcare system that I think would be safe that we're consolidating kind of into healthcare infrastructure. Other areas include telehealth and telepsychiatry, as well as investment opportunities in state agencies. So upgrades that we in certain agencies noticed that system improvements that we saw some negative effects from COVID of inability to provide service sometimes on a remote basis could be improved. And there's just a variety of different areas that we've received in terms of ARPA proposals. So again, those will be flushed out over the coming weeks, be ready in the early part of October, but we'll go into the governor's budget process. So again, in the public side of this, I think what you'll see in black and white will be sometime in the early part of November.
Questions for Mr. Johansson? Representative Connolly.
Thank you, Madam Chair. Mr. Johansson, if I remember correctly, there were some pretty serious cuts to the DOH budget over the past couple of bienniums, and funding reduced significantly for some services. Are those cuts contemplated in the ARPA request fund to kind of backfill them in any way?
Madam Chairman, Representative Connolly, good question. The short answer is no, for the reason that we discussed yesterday, where the ARPA funds are really intended as a one-time investment. But we do have several nuances in the Department of Health budget. I won't speak to the other agencies' budget. That in our budget request, we have considered various proposals within our budget to the governor related to our cuts from the last session. Primarily because we've been directed to by the legislature through the budget bill. If you'll recall, a lot of what was known as our step 3 reductions were not implemented. So the legislature gave us funding for the remainder of this biennium in fiscal year 22, so that those cuts didn't move forward, with the direction to ask for that back in the next 23-24 budget session. So there are a number of requests currently in our contemplated in our budget related to those cuts that took place.
Thank you, Madam Chair and Mr. Johansson. That's good to hear. That's good to hear. Know that I am on the Department of Family Services Advisory Council, and you had mentioned working with Director Schmidt. And kind of we're going to pursue kind of targeting some very specific populations that we right now are not doing. We're not providing some services certainly that other states are doing, perhaps on an experimental kind of program. And I'd encourage you to think about that. And so that population that we're thinking about is foster kids who age out of the system, right? We know that outcomes for those kids are not great. And I would encourage you to think about those kinds of populations as well. One that I'm thinking of off the top of my head are mothers who are on Medicaid who give birth, and the coverage that they have. I think it's only a couple months.
Madam Chairman, Representative Connolly, 60 days postpartum.
60 days, and other states do 6 months. This is a conversation that we had. So experimental programs that go for targeted populations, I think, is a possibility under the ARPA funds. It's all about kind of an experiment. I mean, it's not, you don't have to look at it as the need for continuing funding, but that we're going to do an experiment and see if we get better outcomes. That's it. And I think we could make some real difference. So I'd encourage you to think along those lines as well.
Madam Chairman, very briefly, Representative Connolly, to the point you made about postpartum coverage in Medicaid, we actually have an interesting natural experiment that we were able to undertake this past year. As related to the public health emergency, CMS disallowed any disenrollment from Medicaid. So we have our enrollment is much higher right now than it has been in previous years, because typically folks churn on and off Medicaid when they lose income eligibility or some of those timeline eligibility regulations or rules that we have in Wyoming Medicaid. The federal government has prevented us from disenrolling Medicaid members over the course of the pandemic. We have not seen a big increase in expenditures, likely related to a number of things where folks were not seeking care during the pandemic. Some hospitals were not taking, elective procedures, things like that. But with the postpartum coverage, not being able to disenroll those women after 60 days, we have that natural experiment. So we've been able to see, and the data is pretty initial over the course of 6 months to 1 year, where we can analyze what were the expenditures in a extended postpartum coverage versus what potential offsets might have been by nature of that coverage in other systems. So we are considering those options absolutely of what we could potentially cover going forward.
Thank you, Madam Chairman. I think we'd love to see that data once you do some analysis.
Sure.
Thank you, Madam Chair. You mentioned one of your priorities is telehealth, which I think is a great priority. So obviously that means expanding broadband into a lot of our rural areas that don't have sufficient bandwidth to use telehealth. Is that correct? Is that some of the priorities you're looking at? Thank you.
Mr. Johansson.
Madam Chairman, Senator Furphy, yes, and it's certainly not necessarily in my or Director Schmidt's purview on that particular topic. But I would encourage the committee, I think it was back in June at the Appropriations Committee, the governor and this team that I sit on released a report and a plan to that committee, kind of outlining what those broad goals were. Broadband and infrastructure related to broadband is certainly a big part of that, really more undertaken in terms of the prioritization by Josh Durrell of the Business Council, who sits on this team as well. There is a lot of overlap with many of these goals and many of these priorities over into health and human services, and telehealth, like you mentioned, is a great example of that. The other thing, Madam Chairman, that I'd mention just in closing is everything that I mentioned, again, just very broadly, and there's much more detail in that report that you can peruse, is about the investments from ARPA, or the potential investments going forward. I want to be clear with the committee that part of that plan was also the governor directing us in the health department to update our COVID-19 response plan, which has been ongoing for the better part of 18 months now. And you have seen, and you likely will see in the short term, ARPA funds being spent on that COVID response plan. For example, just in this, as Eric Boley mentioned yesterday, in the last week or two, we have moved forward to provide relief to staff who are working in our hospitals and long-term care facilities, and not just nurses, but going down to other direct care, CNAs, dietary, custodial. We know what's happening in our hospitals and long-term care facilities with the staffing issues now related to COVID. And related to all the work that they're doing and the burnout that we're seeing. So a lot of that money will start hitting the ground to help with those staffing issues. Retention bonuses, things of that nature are planned to, once we have that contract signed, and I think it should be today, tomorrow at the latest, we will start distributing that money. The point, Madam Chairman and members of the committee, is that there are needs that the governor has identified that are much more short-term and immediate to potentially use ARPA funds for in the health response for the pandemic. But he has, and we have been in direct communication on a weekly or bi-monthly basis with legislative leadership to make sure we're not making those decisions in a vacuum.
So I do have one, there was, and this is a little bit vague, but the last 6 months or so, there have been some discussions about the idea of using ARPA dollars to offset general funds, and then putting general funds into sort of a trust, as it were, to spin off money for other programs. Is that something that is sort of still in the air, or has it not really been found feasible? Where would you say we're at with that idea?
Madam Chairman, I'm probably not the best person to answer that, and I think we have governor's office representation here today, or can certainly follow up, have the team follow up with you. My understanding is that there are basically 2 or 3 buckets with how these ARPA funds can be spent. One is kind of what we've been talking about, which are these areas, health, human service, infrastructure related, that you can tie back to either needs or better preparedness and planning related to the pandemic. And then the ARPA funds, kind of dissimilarly from the CARES Act funds, do allow for revenue replacement. Exactly the mechanism with how that will work and how much funding could potentially go into an account to offset general fund revenues, I would certainly not be the best person to speak to that.
Let's see, or do we want to hear separately from DFS and the governor's office on ARPA? Is there anybody else that wants to contribute on those, on that report, or is it just you? Good job, just you. The new director's name. Am I hearing a question? No. Okay, so then I guess we're on to Governor's Health Task Force. John, come on up.
Good morning.
In the front, it says, there you go.
There we go. Is that better? Good morning. I'm Jen Davis. I'm the Governor's Health and Human Services Policy Advisor. Happy to answer any additional questions that you might have on ARPA. I think Director Johansson covered that pretty comprehensively about where we're at right now. And so, but happy to take any questions that you might have additionally on ARPA. Okay. What I was going to do for you all today is provide an update on the Governor's Health Task Force. And Chairman Baldwin and Chairman Wilson are members of that. So they're aware of the update that we're going to be talking about today, but want to share with all of you where we're at currently. So you all have a few handouts in front of you. One you saw the last time that I presented on this, which is just kind of a draft of a strategic plan that the group is put together of some areas that we've identified over the course of this work are some priorities for us to tackle in a meaningful way. They're pretty broad as we're looking at the healthcare system as a whole. Then there also is another handout there that shows kind of the flow chart of how we're currently operating. Basically, our structure right now is we have the governor's office, that then underneath that we have a group of facilitators who are coordinating with the governor's office to help move the groups forward that are doing the work. And then we have the large task force group, which is really composed of a very large group of stakeholders. We probably have 60 or so members on that are really just a variety of experts across the fields that we give regular updates to. And then those members sit on different subcommittees in their area of expertise that they choose to really dig into some of the topic areas that we have elevated as priorities. And then you'll see below that there are currently right now 4 subcommittees. Those have recently changed due to what we're currently focusing on. We've shifted slightly in our priority work because of ARPA, looking at the opportunities that some of this work might present in utilizing some of the ARPA dollars as a proposal to move forward. So we've taken some of the ideas that have come forward that we know might be a one-time ask for some funding in order to help create some of that infrastructure, to help make sure that we get those in front of the governor and all of you for ARPA proposals as we go forward into this first request of ARPA funding. So as you see on the bottom there, those 4 groups that we have right now, one is focused on workforce. And you just heard Director Johansson talking about some of the work that we've already done around workforce, specific to the 30 million that the governor just allocated to the hospitals and long-term care regarding staffing to help stabilize that during this current surge. Additionally, that group workforce is also looking at, as we know, we have a difficult problem in Wyoming with healthcare workforce, which was pre-COVID, and we've seen that become exacerbated during COVID. So one group is specifically looking at workforce. Another is looking at an idea of resource centers. So the reason for the resource center conversation as what we found in many needs assessments across the state, whether they've been done by DFS, the Children's Trust Fund, Department of Health, what we find very often is in our communities is that our citizens are reporting they just don't know where to go for resources, particularly around healthcare, around the aging population, just unclear where to go to get help and connect with somebody that can maybe help them fill out an application for a benefit or help direct them in the right place within their community, or if that service isn't in their community, where else can they find it? So the conversation in that group is focused around resource centers that could be a brick and mortar location, could be focused off of infrastructure that already exists. That group is really breaking that down into more detail of what that could look like. And in combination with that, it's looking at the ADRC, which is the Aging Disability Resource Center, which Wyoming is the only state that doesn't currently have that. So it's looking at how can we think about that collectively. And so that group is really breaking down some of that work and prioritizing it. The other group there is an education group. As we all know, that's always a component of work that needs to be done, is just better education. What we have found a lot in surveys is that the public in general just doesn't always necessarily understand the healthcare infrastructure, doesn't understand how funding models work and how that all comes together. So they're looking at education from the component of how do we have a robust continuing education network for providers in the state, from physicians to CNAs to respiratory therapists, the whole gamut of healthcare providers. But then also, how do we also do that for the general public? And then how do we also ensure that those messages are comprehensive and coordinated between all of the different components of the system? And the last one that we're looking at is an infrastructure around emergency medical services around our EMS system. You'll see that is under the other priority of stabilizing and regionalizing health. There has already been some movement in the state looking at regionalization of EMS services. It's kind of naturally occurring in the Basin area. And so we have been looking at how that structure is coming together to look at how to stabilize the EMS system. As I'm sure all of you are very aware, have probably heard it in your communities, that system is very vulnerable right now. We have had several EMS facilities closed because they can't sustain operations, which then puts communities at risk for response time, for getting EMS to individuals, and really ensuring that we have a good first entry point through that system that's safe and reliable and timely. So we have been spending quite a bit of time pulling a group of individuals together to talk about what are some opportunities in that system. So that is a very big discussion. As you can all imagine, it's very complex. There's lots of moving parts to it. You also have some data in front of you that the Department of Health pulled for our last EMS meeting that really shows our response times in Wyoming, that shows the kind of calls we're getting. And then they've also broken that up by the trauma regions, which we have in Wyoming, at what those different times look like. One of the difficulties that we're finding as we talk with the experts in the EMS system and the county commissioners is sustainability. And Director Johansson talked about the issue with ARPA of a one-time injection, which we could use to help stabilize some in the EMS system. But then it always comes down to, okay, then how do we sustain it over time? And, you know, that becomes a very difficult conversation due to the economics in our state right now. So the county commissioners are part of this conversation about how can we stabilize this. We have the EMS Association, Department of Health, the insurance companies, providers here in the state, just talking about what are our opportunities. Currently, right now, if an EMS call goes out, we have the only time that they get reimbursed for those services is if they actually do a transport. So if they get called to the house and say someone has fallen and they need to go pick them up and they're not injured and they don't need a transport, that's not a billable service through EMS. And so they don't have a steady revenue stream through many of our local areas to help offset those costs. The other thing I'm sure you all have heard is that the difficulty that we also have here in Wyoming, as well as across the nation, is the volunteer workforce is just drying up. People just aren't volunteering in those sectors. And we don't have a lot of paid employees in our Wyoming EMS system. So lots of brainstorming around this, lots of good discussions. I am sure this will be a topic that all of you will be addressing as we figure out a sustainability model of how to continue to fund these critical services in our state. I will say one of the concerns with the county commissioners is there's been discussion about thinking about it as an essential service, which then requires that, that has to be then paid for by somebody. But counties, 21 of the 23 counties are already at their 12 mills. And so looking at, even if it became a requirement for them to do, there's no way to pay for it. So this is a big discussion that I think we'll all be engaged in. There's lots of good ideas out there that we're starting to unfold. Also looking at how do we ensure that our dispatch centers have qualified people to help run an emergency medical call that, can triage the call over the phone. So we're also looking at that infrastructure as well. So that is another important part that we're looking at. Then the last priority that you have in the box is food insecurity. As you all know, the First Lady's initiative is the Hunger Initiative. So what the task force has really focused around in food insecurity is really more about food as medicine programs. How do we utilize nutritional programs for maybe our elderly that, have a specific dietary restriction that isn't always necessarily met through just a food box at the local food pantry. Those that have diabetes and have special dietary restrictions, heart disease. So we're starting to look at all of the different opportunities there. And then also looking at SNAP benefits and how can we make sure that that system is working to the best possible way that it can within the state to help people get enrolled in that as well. So those are really the priorities that we are currently focused on. As you can see from your first handout, there is a lot of priorities that we have. It's a huge system, very complex and complicated. But I think we have a really dedicated and committed group of stakeholders that have been engaging. And the hope is that we can all collectively come together, and as we need revenue, as we need legislation, that we're all on the same page before we get to the point of coming before you all, so that collectively we're doing this work together in the state. So I think there's really good momentum, good participation, and would be happy to take any questions that you all have.
Okay, questions for Ms. Davis? Senator Hutchings.
Thank you, Madam Chair. Jen, you spoke about a lot of things, and I was really surprised you didn't bring up the vaccine mandate and how it's affecting our state. And you said some things like the workforce is drying up. It's drying up. People talked to us yesterday. They're packing up and they're leaving. They don't want to be forced to take a shot to continue to work. And in our healthcare industry, that seems to be huge. What is the governor doing in respect to the vaccine mandates? Federal.
Ms. Davis.
Thank you, ma'am.
Chairman Wilson, Senator Hutchings. The governor, as you all know, put out a press release that he is working about the Biden overreach that has come out regarding the vaccine mandate. There is a meeting with Republican governors next Monday coming up that they're having discussions with. He's working with our senators at the national level of, what can we do from that perspective to look at how can we maybe find some alternative options around that. So he's really digging into that quite heavily, both here at the state level and having the AG look into that, and working also with Republican AGs across the country as well. So right now, I think he's really, as we all heard yesterday, really waiting to see what officially comes out so that we know specifically where we need to intervene. And so I think as we all start to get more information, then I think it'll be a little bit more clear what direction we go. And as you all heard yesterday, it is a piece of the puzzle in the workforce for sure. But I think there's lots of other comprehensive pieces around the workforce. Pay has been a big issue why people are leaving. As you all heard, burnout is another issue. Just recruitment to the state it's been difficult even pre-COVID. So there's a lot of complexities around that workforce issue for sure.
No questions for Ms. Davis? Oh, Representative Connolly.
Thank you, Madam Chair. Ms. Davis, when I look at this list of priorities, it's pretty overwhelming. It really is. And when I look at them, I think that one of the solutions would be for us to accept Medicaid expansion. And I'm curious if the committee is at all addressing that issue so that we can actually meet these priorities that you have listed here.
Davis.
Chairman Wilson, Representative Connolly, thank you for the question. Medicaid expansion has come up in all of the committee discussions as an avenue that addresses some of our healthcare issues. As you all know, that has come before the legislature and that has not been able to move forward yet. So I think that it is, something that again would be entertained if it came to the governor's desk to look at. It is definitely part of the conversation about how do we think of these multiple opportunities to really address some of our healthcare needs in the state.
More questions? Ms. Talbot? Wait a minute. Oh, good. Representative Romero Martinez. I can't see you. You're in a very little box. Thank you, Katie.
So you had asked for some questions. You had mentioned something about food as medicine programs, and you had talked about local outreach programs for food. Is this still just in the idea phase, or are they, is the governor's office, or are we just kind of brainstorming to reach out to those social service organizations?
Ms. Davis.
Chairman Wilson, Representative Romero Martinez, we are in still kind of that brainstorming phase, moving into the phase of identifying specific programs for that. So there are multiple opportunities across the nation of different programs that have worked that address very specific things. There's some that are just addressing cardiovascular disease. There's some that are addressing maternal health. So we have had conversations with several of those. We've also worked with the First Ladies Initiative and really trying to think about maybe what are some ideas out of some of those national programs, but then with what's happening with the Hunger Initiative, and Wyoming has a great program, Sensible Nutrition. Is there a way that we could do something Wyoming grown that is similar to some of the national programs that we're seeing? And our facilitator for that is Josh Hannes with the Hospital Association. And so he's looking at a variety of different ways that we can look to address that. Another thing that is happening with ARPA that just ties into that is looking at the Wyoming infrastructure for food banks and the delivery system throughout the state, which we saw some challenges in during COVID, and making sure that we have a robust infrastructure system and then how this plays into it. So that one has some big systems things that we'll be looking at in combination with the actual program for food as medicine.
Just a quick comment to close out, if I may. Several years back, the Department of Health put out like a 2 or 3 day training called Cultural Competency in Mental Health, and they brought Elena Avila, who was a curandera from New Mexico, to talk about holistic health. It was mentioned yesterday by several panelists about the importance of holistic health or food as medicine, as you had put it, and I just didn't want that to kind of fly over. And I think in my district, there's a huge demographic of people who would be interested in that, and I just want to open myself up as a resource to try to be involved in this discussion as it moves forward. Thank you.
Good, very good. Thank you, Representative Romero Martinez. Any more questions for Ms. Davis? Representative Ottman.
Thank you, Madam Chairman. Hi, Tim. I was just wondering, sometimes with local things, with the food as medicine and volunteerism and the EMS programs and things, some of the people in my district, I'm sure it's around the state, have tried to do these things, but we're running into a lot of regulations and rules and requirements that really limit people. 1, financially, 2, it would take them away from their jobs, and 3, they think government is involved in everything, so they don't know how to get involved. Is there any thoughts about being a little bit more user friendly with volunteerism and local benefits, things like that? Thank you.
Ms. Davis.
Chairman Wilson, Representative Ottman. Yeah, as a simple answer, there has been a lot of conversation around the volunteer ISM that we have across the state that runs many of those programs. So when we think about food banks, lots of that is done by a volunteer network, whether that's done through a church or whether that's done through an organization, even thinking of in the elderly Meals on Wheels that we have in Cheyenne. It is challenging for our volunteer services to really get a handle on addressing the social needs that we have in the state. And so we have looked at, are there opportunities with ARPA where we can really build infrastructure with some one-time injection of funding around these multiple issues, and food is one of them. And so I think that as we look at rules and regs, we've also been having that discussion too. Are there ways that we can think about these things differently than maybe what we've done in the past? And so that is definitely part of the conversation. As you all know, it's so complicated because we have federal money tied in, we have state money tied in, we have, foundation money tied in. And so many of these programs have a very comprehensive braided system of funding and then rules that come with each of those different funding sources. Even when you get foundation funding, there's requirements that they have to them too, and expectations. So it's really looking at how do we comprehensive look at the system we have now, and then what tweaks can we make to it that might make it more efficient and in many cases more affordable, but yet sustainable. That's our big thing is especially when you have a variety of funding sources, sometimes the funding sources dry up, and then how do you keep something going? So it really is looking at where's the sustainable parts in the infrastructure that we can lean into.
Thank you, Mr. Chair. I had a question after the comments and stuff from yesterday. It was brought up that as much as the nursing homes could be as many as 70% of the people could be dependent on federal funding. With the actions that we've seen out of this administration, I would formally request that maybe you take back to your task force the idea that we need to start looking at how we can become more independent and self-sufficient. I think we're depending way too much on the federal government. And I really think we need to wake up. I worry that things are going to crash. We're so dependent. There's talk about expanding Medicaid, and everybody that I've heard, every state that's done that, it's been a disaster. And I just think we need to look at how we take care of ourselves. I think this is not the first administration that's been hostile towards our state and our primary economy, which is energy. And I think we need to wake up and start acting as a sovereign state. And I guess that's what I would do, is formally request that the governor have his task force that he's put, look at how we can actually come up and become self-sufficient and less dependent on the government. I mean, I am terribly concerned when they can do something like he's done. And like I said, this isn't the first administration that's tanked our economy. And I think we need to start looking at how we push back. And I do think that it's problematic how dependent we are right now on federal funds. So that's a suggestion, I guess. I would appreciate this committee maybe reinforcing that, because I do think that it's the most obvious to me in healthcare. That's where I see the biggest problem coming, because we all recognize what happens if we can't have doctors and healthcare providers here, and we can't have them. We can't have the government hurting our state and the citizens like it is. So that's a suggestion. I would appreciate you taking that, Jen. Thank you, Madam Chair.
Senator Hutchings.
Thank you, Madam Chair. Representative Wharf kind of brought up an issue that's kind of dear to my heart. And I think when you think about what you can do as a group, we forget about community. We always want to go to the state or to the federal government for things. And I believe maybe 60, 80 pastors came to visit the governor at one time. I don't know if you were there. you'd hope that one of them, two of them gave you a business card and you say, hey, churches, time to step up, community. We're all here. I have an extra can. We could give to somebody, and my can multiplied by his, hers, whatever. We can help our own community instead of always looking for a handout from somewhere else. So just a thought. They were there. And I think they were there to let you know they could be used. Thank you.
To add on to that, I will say, so I'm on the task force, and there is a significant discussion about community resources. I mean, that is very much a part of the conversation. So, okay, any more questions for Ms. Davis? Okay, before, I will take public comment on this and the previous one. Thank you, Jen. But Stefan Goer, Boston. Oh, there he is, right in the front. I was just going to say, for the committee's knowledge, about 10 years ago, I think it was the year that Senator Hutchings and I came into the legislature. So it was probably issued in 2012. Department of Health did a study on the fiscal impact of withdrawing from the Medicaid program. I believe you were there. I don't know if your hands in France, you and France were, I think, fairly new. But if you can dig that up and send it to me or to LSO, I think it's 10-year-old information, but I think the analysis would be interesting for people with this discussion. Thank you. Okay, is there any public comment on the ARPA or the governor's task force? No. Okay, then. Public comment on that topic is closed. Now we're to yesterday's 12:30 topic. We're speeding up. Now we're only 21 hours behind. So let's have update. Actually, I guess Stefan, you're back up. State Hospital and Life Resource Center Task Force, mental health waiver, and then we'll go to the suicide hotline.
Thank you, Madam Chairman. I think I'm on for all three of those, so I'll try to be efficient with your time. In terms of the State Hospital and Life Resource Center projects, just as background from some of the newer members of the committee, back in 2014 in the legislative session, the legislature established a task force to look at the capital construction needs of all of the Department of Health facilities. Long story really short, ultimately the legislature invested as priority projects a rebuild of the Wyoming State Hospital and a rebuild of the Wyoming Life Resource Center with new missions, new populations served to solve a variety of issues related to patient care at those facilities, who the state should and should not serve at those facilities, as well as decompressing some of our Title 25 issues, wait list issues. And so those capital construction projects have been going on for the past 2 or so years, and can give you a status update on those today. The Wyoming State Hospital has been on time and on budget with that capital construction project, and all of the patients were moved into the new facility in the fall of last year. And we're very excited and very grateful to the legislature for investing in that facility. If you haven't seen it or haven't been in there, please get in touch with me. It's a wonderful new facility that we're very excited to be able to provide really state-of-the-art care now at the Wyoming State Hospital, which we were operating sometimes in 100-plus-year-old buildings on that campus. That project will be complete fully. Right now, we're in the third phase of that, which is really some changes to the administrative buildings for the staff that work in administration there. So patient care in the new facility is ongoing. There are some growing pains when you move into a new facility. We have found things as we got in there that needed to be changed, updated, et cetera. That always happens in my somewhat new experience with managing capital construction projects at the Department of Health, but it's very difficult to know a car until you take a test drive or take it off of the lot, which we've been doing for the past year or so. That project with the administration buildings being complete, it will finalize this fall. So we anticipate to be completely finished with the State Hospital project by the end of this calendar year. On the Life Resource
Stefan,
Center.
if I can just interrupt you on that.
Please.
I remember last year Senator Schuler had some questions about possible repurposing of some of the other buildings on the campus. Is there any information on that? Or looks like Co-Chairman Baldwin wants to comment. Go ahead.
I do. Thank you, Madam Chairman. This is another task force yet on which I serve. I talked with Senator Schuler actually before I came over here, whenever that was. It seemed like a month ago, but it was only 2 days ago. They actually just undertook a investigation and a study by some outsourced people about utilization of those buildings that are no longer occupied, that are no longer being used at State Hospital. That study is out, and she didn't get the email to all of us yet, but she will this week about those findings. And there actually are some pretty good uses for those buildings. We're going to be able to utilize those with funding, of course. But the community of Evanston is very interesting. That community has been very successful in utilizing abandoned structures there. We had a committee meeting there, I don't know, 4 or 6 years ago, whenever it was, in one of the old railroad buildings. But the community of Evanston has been very successful, and they do have some repurposing studies, some repurposing goals for those buildings. There's a pretty significant number, Breck Stephen knows the number, but there's a pretty significant number of buildings. A state hospital is an integral part of the community of Evanston and Uintah County. So there are some studies. We will be getting an email from Senator Schuler and probably from myself about those plans and those ideas.
Great. Anything to add to that, Mr. Johansson?
Madam Chairman, hard act to follow. Senator Baldwin is right. We have been in touch and in contact with the group in Evanston, Economic Development Group, that is interested in repurposing or reusing some of the buildings. I will just mention some of the challenge associated with that is just the physical plant itself is tied through kind of a central utility, a very bizarre central utility function that connects all of the buildings. So in terms of maintenance, if you want one of them, you get them all from a maintenance perspective. So we've been clear in communicating with that group that from a staffing and an efficiency and a cost perspective, we will be at the end of the calendar year, so around January, basically setting those buildings up to be boarded and not maintained. So there is a little bit of a time constraint here to come up with a plan to reuse those, but we have been working with that group to make sure that we don't get the bulldozers out too soon if there's another use for those buildings.
Okay. Any questions specific to Evanston? Okay, go ahead with.
Madam Chairman, very briefly on the Life Resource Center project that is also underway. I would say it's a little more than half complete in terms of structures. We are shooting for the end of this calendar year to be complete or have most of that work substantially complete, where the Department of Health can begin occupying all of the buildings and using it within its both its intermediate care facility and its skilled nursing facility licensures that are planned for. The committee may remember early on in the project when we were tearing down some of the buildings on the campus, we ran into significant ACM or asbestos that caused quite a bit of delays. It's been a tough process to get the project back on track. And then COVID pandemic didn't help, where in 2020 we did run into those delays issue as everyone did with staff and workers going down, getting sick, being quarantined. I'm happy to report though, over the past 6 to 9 months, especially with the new director of the construction department, Jerry Vincent, has been very good to work with, and the project is accelerating. The buildings that have been handed over to us over the past calendar year have been high quality. The work is moving much faster, and I am optimistic. I'm sure this is not final. I am optimistic that most of that work can be completed by the end of the calendar year, and we are very excited to move into that new facility and get started with the new missions there. Same offer, anybody who's in the Lander area that wants to see the construction project and how the new campus is coming along, please let me know. We're always excited to show it off. So Madam Chairman, I will stand for any questions on that update.
Okay. Representative Upman.
Yes, thank you, Madam Chairman. If you could, I did have opportunity, well, we all did, we went through it, and it's coming along very nicely. And I just hear bits and pieces, but what I'm wondering about is some of the buildings were scheduled to be demolished, I thought. And then they said, well, there's some of them that we have found that are very sound, even though they're older. So they're going to utilize those. But with that population, I had hoped, because of the situation in Fremont County, that facility would help with Title 25. And I'm told that's probably not the way it's going to go. But also, then from the director of that facility, there are some long-term clients there that of course will will be maintained and taken care of. But after that, that it would be more short-term. And so there's a lot of opportunity with that facility and all the different buildings. What is the main, what's going to go on there? I even heard the state police were offered a building. So I'm just wondering.
Mr. Johansson.
Madam Chairman, Representative Ottman, a couple of questions there. I'll unpack them and handle them one by one. In terms of the old buildings, you're right. Just like the state hospital, there are some buildings that have been or just need to be torn down that are not really able to be repurposed. Other buildings on the campus and other land on the campus is under discussion for additional uses, both from state agencies like state police, highway patrol have expressed interest in using some of the buildings that are on that campus. Department of Family Services, I believe it's the Emerson building that is going to be repurposed for that purpose or for those staff locally that can use that. So it's kind of a mixed bag. And then we've also heard some discussions over the years and even recently that the city of Lander may be interested in some land swaps on the far end of the campus that could be used for some residential development, for example. So those conversations in terms of repurposing are certainly happening. In terms of the mission of the facility, happy to send you and the committee the facilities task force, which was legislative and executive branch from years ago, what was ultimately decided and legislated as the mission and the population served of that facility. And it's not, to your point, it is not everybody. There's also some complication and some nuance to your point about could that facility specifically, operate as a psychiatric facility for Title 25 in Fremont County. The difficulty there is really under some federal regulations where we have to be careful not to be classified as an institute for mental disease, which means that the facility is primarily dedicated to serving as a mental health facility, and more than 50% of its population are treated as such. So we have a combined mission with intermediate care for folks with intellectual and developmental disabilities who can't at that time be served by our community programs. But the intent is not necessarily on a short-term basis, but on an intermediate term basis to provide intermediate care for those folks and look for community placement outside of the institution. For another population, another question you asked, Representative Ottman, is directly related to Title 25, but not the provision of psychiatric care. And that is a new mission for the Life Resource Center, is a skilled nursing facility for a certain subset of the population, again, that was legislated. Folks who have significant behaviors, high medical needs, things of that nature, where the private sector nursing homes either can't or won't serve that population. That is a very distinct part of the new Life Resource Center mission that will have a direct impact on Title 25, because currently, as I mentioned, I believe I mentioned yesterday, we have a lot of long-term patients in the state hospital that shouldn't be there. And they are occupying what should be short-term acute stabilization beds in Evanston. Once we open up the Lander facility and treat those geriatric psychiatric patients in a more suitable setting, nursing home setting in Lander, that will free up space at the state hospital. We're optimistic that will begin solving some of the problems in your local communities with Title 25 wait lists, with the frustration that we all share about how quickly can we get somebody into the hospital for evaluation for a Title 25 commitment. Currently, that's about 17, 18 of the 100 beds at the state hospital. So if you imagine kind of a chart where you have that population on the top, and we're able to remove that and treat them more suitably, and in a less restrictive environment in a nursing home in Lander, that frees up those beds at the state hospital. So in closing, I think to remind the committee that what we were directed by the legislature and by the task force to do with these projects is really to operate as much as possible between Evanston and Lander as what we called one facility with long streets. And so what's been very positive, even before we finalize all the projects over the past couple of years, is that the work that is now shared and the collaboration that's happening between the two facilities in terms of their populations.
Representative Ottman.
So with all of those pieces and parts there until, because there's got to be 30 buildings in that, and I know the Honor Farm also.
Representative
is
Ottman,
using-
could you speak up a little bit? Sure. Thank you.
I know the Honor Farm is also utilizing some of that property, and which is all good. But will you be reporting back to this committee on like funding and how that's going to change and different things that are going on there? And like if there is land swaps, how that's all going to come together? Will that be through the task force, through this committee, or a news item or whatever it's going to be? Thank you.
Madam Chairman,
Johansson.
Representative Ottman, those types of, if they happen between agencies or between, government entities locally or on the state level, typically happens through the State Building Commission. Any of those, we can't make those decisions on our own, but more than happy on those types of issues or repurposing of land or buildings, more than happy to report back to this committee on the status of that. Over the past couple of years, since I've been involved in the projects, we have reported all of that up to the task force, which generally has a legislative requirement to report to the State Building Commission and is often on the agenda of this committee as well.
Senator Hutchings, do you have a question or just, okay? Any more questions for Stefan on this item? Okay, then the next one is the Children's Mental Health Waiver Statutory Language Clarification. And I was thinking that I had seen language on that somewhere, but I'm not sure I have it. Do we have it?
Madam Chairman, I don't believe it's in the presentation deck that you had, but I can be quick with this because we don't have we haven't suggested language for that program, and I'll let you know why. As you know, the Children's Mental Health Waiver and its accompanying program called the Care Management Entity was discussed as a possible budget reduction for the Department of Health last year or last session. Ultimately, that budget reduction did not take place. It's Representative Connolly, to that point I mentioned earlier, that will likely be discussed again going forward in the upcoming budget. But the issue here is that if the program is intended by the legislature, this committee, the Appropriations Committee, to continue, just a small recommendation that we would have to take it out of session law. I believe the last session law where it was in was 2006, and codify it into statute. Just one of those, uncomfortable state agency things where we look for that authority. So it's really not a huge issue, and we're happy to share what our draft language would be if it was the legislature's purview to codify that program in statute.
So I wonder whether, and committee, just so that you know, if this came up in kind of a funny way, last month, something like that, I am every year help out with the public manager mock JAC training that they do. And so they pass out the various budgets that they are going to pretend to present to the pretend JAC. And one of them was the Department of Health's budget from last year. And as I was reading through, I noticed that there was a line in there about a program that was just in session law. And I thought, so I actually emailed, turned out that I think you had just been counseling one of the people who were going to do this mock training as well. So that's why I put it on here. But I wonder then, Stefan, maybe the best thing for you folks to do going forward is when you present to JAC, let JAC run that bill if they decide to put the program in there. I mean, that would probably be more concise and less confusing. Does that make sense?
Madam Chairman, happy to do it that way. We don't have a preference on, how that would run.
But just because they can draft bills all the way through the end of January and still have bills, whereas, November is our last one. So that'd probably be the most effective way of doing it.
Happy to
Okay.
follow up, Madam Chairman.
Very good. I'm just going to move on from that one then. Okay, next we've got update on the suicide hotline. So I know we've got you, and then we also have some other folks in the audience, I realize, that want to talk about that. So we'll let you or whomever you delegate from the Department of Health give us the initial presentation, and then we've got some other folks too. So go ahead.
Madam Chairman, I will be brief on this update for the committee as a little bit of a history or a reminder. In 2 sessions ago, the legislature was gracious enough to provide some state general fund for the Department of Health to operate an in-state suicide lifeline. As you may recall from previous committee discussions, Wyoming was one of the only states in the union that did not have an in-state lifeline. Instead, our calls were routed to the national call center. So legislature made the decision to provide, I believe it was in the $200,000 range, some funding to start up a Wyoming-based suicide lifeline. We did a competitive bidding process for that initial lifeline and ultimately selected Central Wyoming Counseling Center, who began, I believe, launched that lifeline in August of 2020. Because there is no requirement to have just one suicide lifeline, and because Wyoming does struggle to have 24-hour, 7-day-a-week coverage, in August of 2020, we also brought on some additional coverage for suicide calls in Wyoming through Waller Hall Research, which is based in Graybull. Between those two entities, over the past year, we cover about 90 hours a week on Suicide Lifeline for the in-state centers and the in-state calls. And then beyond those hours, the calls still go routed through the national call center. The plan going forward, Madam Chairman, between now and the budget discussions in the next legislative session is whether we can find funding or free up funding to have 24/7 coverage. That obviously takes money to expand that and staff that in state, with the idea being, the theory being that an in-state call center has more tacit knowledge of resources available, not something that's happening, at the federal level where referring folks to 800 lines and things of that nature. Those conversations are ongoing with the governor's office. If we have, CARES Act or ARPA dollars that could be used for that for a brief period of time, but expect that this discussion would also come up in our budget hearings with committee number 2. And I know there's folks from the Central Wyoming Counseling Center Lifeline ready to speak to some of those issues.
In committee, let's just hold all the questions till the end of all the presenters so that we don't overlap if necessary. I do see, Stefan, that I had, we had Stephanie Pyle and Lisa Wardman on from the department. Are they to bolster you, or were they just to answer questions?
Madam Chairman, I mean this in the least offensive way possible. They were available yesterday. And as you know, we have a lot of work with the pandemic response going on.
Can't
So
understand how that happened.
I volunteered for this today.
Good for you. Good for you. Okay. We have some more folks I know in the audience. Come on forward, and you may as well stay there, Stefan, in case somebody wants to ask you a question at the end. If you're here to present on the suicide hotline, please come up. We have just enough chairs, it looks like. Good. And if you press the node, there you go. It says-
Got it.
There you go. Good.
Got it. I'm Jeff Henney, the president of Waller Hall Research in Graybull, Wyoming, and one of the founders of the Wyoming Lifeline. You guys want to go to?
I'm Bernice Hadzaga. I'm the director of Central Wyoming Counseling Center.
And I'm Kevin Haziga, CEO of Central Wyoming Counseling Center.
Welcome.
Thank you.
And if I could start, actually, we might start with Mr. Henney if we couldn't, because I know he's got another presentation that he
thank
has
you
to
so
depart
much.
for, if that's okay with you.
Sure.
I know you guys, I think you were first, but I mean, we'll let him. Go ahead, Mr. Henney.
Madam Chairwoman, I really appreciate that. Fellow senators and representatives, thank you for your time today. We just wanted to update you on what we've done in the last year or in the last 15 months. The Wyoming Lifeline in Graybull and the suicide hotline in Casper, run by the Central Wyoming Counseling Center. We both launched in August of last year. Before that, there was no one in Wyoming running a suicide hotline, and all of the calls were being routed to the national hotline. We're both affiliated with the national hotline, so folks just dial an 800 number and then it gets routed to our call centers. We operate on different hours at this point in time. We in Graybull are operating from 6 a.m. to 5 p.m. Monday to Friday. And between the two centers, we're probably covering about 50% of all hours that are available in a 7-day, 24-hour period. So the goal of both centers, our center for sure, and I'm sure Bernice and Kevin's as well, is to increase coverage to 24 hours. Just wanted to let you know a little bit about what we did. We started in August of last year covering 4 counties and doing noon to 5 days a week. We expanded to 23 counties in October, And in March, we expanded our hours from 6 a.m. to 5 p.m. We've also done a lot of educational outreach. I think Representative Flitner passed out some of these little wallet cards that we've produced and distributed throughout the state. We also have these 4x6 cards that we've produced that go out to that we bring to various events that we cover. We've also sponsored billboards over the last year, and they rotate throughout the state. And I actually saw one of them driving into Casper this morning. It was right beyond there. So you're not going to see it driving out of Casper, but driving into Casper, it was right outside the airport. And that one of our billboards is generously donated by a family whose child was lost to suicide. So they're paying for that billboard, and it rotates throughout the state. We've got relationships. We're developing MOUs with a variety of different organizations throughout the state to expand our coverage. We're reliant mostly on foundational money and in-kind contributions. And we've developed a resource list of about 300 resources statewide. So it's been a busy year. We're hoping to continue the expansion and looking forward to 988 when that comes in July, when unfortunately calls are probably going to go through the roof at that point in time. So thank you.
Okay, questions for, actually, do you have to depart right away or have you?
No,
got
I do not.
half hour? Okay,
Yeah,
good.
I've got till
And I just
10:30.
want, before we go on, I just want to be clear. So the lifeline number, the 1-800-273-TALK or 8255, that works for both of you, right? And it's
That's
just
correct,
routed.
Madam Chair.
Okay, so I just want to make that because we are being broadcast live so that people know the suicide prevention lifeline in Wyoming, the number is 1-800-273-TALK, or that is 273-8255. And I just want to make sure that people have that available, just in case. You never know when you announce it once, and it might be useful.
Thank
Madam
you.
Chair, if I could ask you also, we initially, began utilizing a text line as well for only Wyoming callers.
Okay.
So
What's that?
if we could give the text
Yeah,
line.
please.
The text line number is 307-776-0610.
307-776-0610.
That is correct.
Okay, so just to repeat, that's a text line just for Wyoming, 307-776-0610.
Thank
Okay,
you, Madam.
I just like to, may as well.
No, that's very much
beam 'em
appreciated.
loud.
Thank you.
Okay, so let's hear from you folks and then we'll get questions.
Okay, thank you, Madam
Welcome,
Chair.
Bernice and Kevin.
Kevin first.
Thank you, Madam Chair and committee members. If you'll forgive me, I'll try not to go on too long. I'm so incredibly proud of the work that we've done over the past year here. You have in your material, the information we gave to Governor Gordon when he visited our site about a month ago. There's a lot of things we've been able to accomplish in the past year. And I think one thing that I'm extremely proud of is our connections across the entire state, that we provide services and provide this service to anybody in Wyoming, actually anybody with a 307 area code. It comes to us when we're here. We have blessed with a director who has over 22 years of experience in this kind of work. For me personally, I am so blown away by the work that is done by the staff in terms of active rescues, in terms of connecting with law enforcement across the state. We're part of WAMSAC, so we have the ability. I interact on a regular basis with all the WAMSAC members, so we're aware of what all the services are across the state. And it's really inspirational work. Unfortunately, we're very busy. Bernice can talk a little bit about the number of calls we get from adolescents now. You'll see the numbers here, and I won't take up too much of your time. I want to be respectful, but there's a lot of good work that's happening, and I'm also happy that Jeff is here as well, and that we're providing everything we possibly can for this population. I also want to mention that we're part of the governor's task force on the governor's challenge to prevent or reduce veteran suicide. We know that 22 veterans a day do commit suicide, so we've been working with the veteran population here as well, which we take a lot of pride in. You want to add anything, Bernice?
Well, aside that I was pulled out of retirement to establish this.
What better
this-
place to come?
Yes, I'm very honored that I was chosen to implement and be the first suicide lifeline here. As Kevin said, I have over 22 years of suicide prevention experience amongst human trafficking and crime victims and domestic violence as well. And of course, veterans, which hold a special place in my heart. I also, in this past year, but mostly in the past couple of months, have embarked on a road trip through the state of Wyoming to promote the Lifeline and to also let them know that the Lifeline is not only for crisis calls, it's also for anyone that is having a rough day, that just wants to speak to someone. We're there on all levels to just be that support for everyone, and have that lending ear, to de-escalate, talk to someone on that bad day that they have, because we do have a lot of those calls. We have frequent callers. And I also want to express that we have a great relationship with MAPSAC because my call center specifically, we have that warm handoff. So I'll guide you through one of our typical calls. When I get that typical call, because I also answer the phone, that typical caller may call us. It could be a child because we get them as young as 10-year-old in our center. And we may speak to the parent. We make sure that that caller goes to the appropriate clinic, which we do have that provider. I personally speak to that CEO of that center and make sure that that connection is made and treatment is established. I do not let go of that caller or the family until that treatment is there. I just do not give them the phone, here, call there. I make that connection. So I make sure that that treatment is through, and I do the follow-up to make sure that that connection was made. So that's how I follow through the whole line. So that's what we are here there for. I just want to make sure.
That's great. Before we take questions, could one of you just talk briefly about the transition to 988 in case people are not aware of what's going on with that?
That is in a work in progress. It's going about, and I think the transition should be completely by next year, 2023 of July, I think.
2022.
2022, I'm
Yeah.
sorry, should be finalized. But of course, we were late in having a suicide prevention call center here. So it's a work in progress. We're still in the meetings and in development and in the structures.
Just, I think, even explain what it is.
Yeah,
because people may not be able to-
I can explain a little bit of that. What's going to happen when this gets fully implemented is the 988 calls, somebody calls, they won't call the 1-800 number anymore. They'll call 988. 988 will move the call. The thing that's a little bit complicating about it, Madam Chair, is that it won't be like right now, it's based on your area code. So if anybody in the 307 number calls, they'll get to one of our centers. When 988 happens, it'll be more based on where they're calling from. So I know that there's a lot of technical issues that still have to be worked out in terms of cell coverage and with the providers, with the telephone providers across the state, what that would look like and what work Wyoming has to do to have that prepared. So I do know we're working with Lindsay Martin and prevention and with the state on committees and trying to figure out how this is going to work. But what's supposed to happen when that deadline hits is all of the calls will go to 988, and then from 988 we'll go to the individual centers.
And Madam Chair, that's a national program, as
Right.
you well know.
But so to just be clear, if a person, and I don't really know how these things work, if a person has a cell phone number with a non-307 area code, does the system think they are in Virginia
they
or
go
is it
to-
geolocated
Like
somehow?
my cell phone is 415, it would go to San Francisco.
Right.
We've actually gotten calls from South Korea at our
Yeah.
center.
Yes.
I'm sure you have
We have
too,
as well.
right? Somebody has a
Detroit.
307
Yeah.
area code.
And,
Yeah.
and to go back to the texting, which makes this kind of exciting right now, is the texting line doesn't work like that. Our texting line is only strictly for Wyoming residents. So it's a little bit separate and apart from when somebody calls the 800 number. But there is work that Wyoming has to do to get everything up to speed, to be able to move this forward with the deadline being July of 2022.
Okay, questions for any of the folks on the hotline? Senator Murphy.
Thank you, Madam Chair. Well, as Representative Connolly knows, in Albany County, particularly Laramie, we have a big problem with teen suicide. I'm just curious, what are you doing to try to get that information out to the high schools and to maybe the university? So that if these kids have a problem, they can truly reach out for help. So thank you.
So Senator Purphy, thank you for your question, Madam Chair. We actually have an MOU signed with Laramie Cares. And in the next few months, we will be working with them to integrate Laramie Cares into our suicide prevention hotline. And so calls that are coming, it'll still be the national hotline, but Laramie Cares will be doing further outreach. And then we've distributed these cards to prevention specialists in that area.
Senator Murphy, I'm sorry, my Spanglish kicks in sometimes and I don't do great pronunciation. Matters Representative Wilson, Madam Chair. I actually, as I mentioned before, I have embarked on a road trip, so I promote the Lifeline, but we have the school-based program. So and with the school-based program, I am involved with the school-based program with our clinicians. And we are bringing that into the schools. So that's why we are getting a lot more of students. And I am actually going to be providing Talk Save Lives. And Rollins, in the new library in Rollins, I was asked to create, to speak at because of teen suicide. When I was there about a month ago. So I'm going to be hosting some events. So I'm in the process of that, but we are, CWCC is going to be doing a lot of adolescents and teens, not only with teen suicide, but with human trafficking and, oh my God.
Domestic violence.
Yes, thank you so very much. This is exciting for me, so I hope that answered your question.
Yes, and if Senator Furphy and Madam Chair, if I could add, we, as Bernice had mentioned, we are in the school districts. We also have embarked on a contract with the Wyoming State Education Department through Project Aware to provide virtual treatment for students in Uinta County and looking at other counties as well. So we'll have boots on the ground in Uinta County and we'll be providing some telehealth. And of course, we all know that how important talking about suicide is with everyone, children and adolescents especially. Because if we can have this be something that can be discussed that isn't doesn't have a terrible stigma attached to it, then we've made some real progress on that. But really, it's heartbreaking the number of calls we get from children and adolescents.
More questions? Representative Ward, did I see your hand before? Okay. Representative Connolly.
Thank you, Madam Chair. I'm curious about the expansion or the potential for the expansion of your services. When I look at your numbers, first of all, I mentioned to you, and it's heartbreaking, right? But we're so glad that you're there and doing this work. My guess is that with the 60–70% of calls that aren't being answered by you, they're not getting the follow-up that we just heard about. that follow-up that does, a direct connection, knowing who has space, who can help an individual rather than just having a conversation. So I am curious, first of all, if that's true, that you do far more than what the national hotline does. And if that is the case, then what will it take to basically, it looks like, expand your hours?
Representative, do you want to take that?
Bernice.
Madam Chair, Representative Connolly, I never make a promise that I can't keep. Everything I've told you from my follow-ups is true. I have documentation that proves it. So you can feel free to contact me and show you my documentation of my follow-ups. I do not do something, like I said, I will not promise something that I cannot fulfill. And, and when I do make my follow-ups, I follow it to the end. And that is, we are a facility. CWCC is a facility and it's a treatment facility. And I make sure that the treatment is given properly. It is a concern because we're not 24/7. I work anywhere between 13 to 16 hours a day to make sure that every phone call with follow-up is done correctly.
Madam Chair, I'm so sorry. I made myself misunderstood. I absolutely believe you. I absolutely believe you. What my question was, is that when the calls are answered by the national hotline, they don't do what you do. That's my assumption. They don't, because they don't have the knowledge of Wyoming like you do. So I would like to say that 60 to 70% of the calls that are going nationally to instead go to you because of my assumption that they're going to get far better care, the care that you're giving to those callers.
Thank you.
That was my point. That
Thank
I
you
don't
so
think
much.
I don't think they're trained unless I'm wrong.
Thank you.
I don't think they're trained. And so because of that, again, I'd like to know what are the efforts that are going forward in order to increase the number of calls that are answered by people like you.
Representative Connolly and Madam Chair, if I could answer a little bit of that. When we received some of the funding for the state, we implemented everything that it would take to be 24/7. We have the iCarol system, which is a high tech for those of you like me who are not into all this technology. It's an answer. It helps with, it's a platform for taking the calls. We invested in all of the technology, everything that we would need, the hard technology, computers and such. We have a wonderful space. We have the chairs there. We're just ready to go. So the minute that we are able to add shifts or add staff, the only thing that we would have left to do would be obviously the training that would be required for new staff that come on board. But we're set up. When we set up for the few staff that we have, we had to do everything to make sure technologically that we had everything in place. So we're good to go.
Yeah, we are as well. The only thing that's standing in our way is funding. But we've identified some funding and our intent is to expand in October, bring on maybe another 20 hours a week. That's our plan at this point, in the goal of ultimately getting up to 24/7.
Kevin, you want to flesh that out at all?
Madam Chairman and Representative Connolly, I appreciate the comments from the contractors here. Just from the state's perspective, I want to be careful not to throw too much shade on the National Lifeline. Representative Connolly, it's not that they don't do anything. And they can't refer to Wyoming-based resources. It really, I think the legislative intent and a lot of the discussion was about, should we have folks based here who have more tacit knowledge? But keep in mind, we don't have a call center based in every community, so it's not your neighbor answering at that call. So the real policy decision comes of what's the most efficient and best use of either state or other resources that we have for when the calls should be answered by the vendors that we've set up here in Wyoming. In terms of expansion, it comes down to money, obviously, to have that staffing and have that ability to take those calls. And as I mentioned before, both with funds that might be available on a one-time basis from COVID relief dollars, ARPA dollars, et cetera, those conversations we're having with the governor and his staff. But that would be a temporary infusion to have it staffed up here in Wyoming.
Although, Stefan, I wonder, and I understand the governor's aversion and desire to not have sustainability problems with the one-time funding, but at the same time, one could only hope, perhaps not, but that assuming COVID is resolved or minimized, then perhaps the lifeline calls might go down too. I mean, you could hope that.
That's not the anticipation, Madam Chair. With the 988 implementation, the anticipation is that calls are going to increase threefold, fourfold on a national level at least, and we would expect that to be the same in Wyoming. Hopefully not, but
Well, you're just a
I
ball
know.
of triples. Okay, then any final questions for these folks? Just on Senator Hutchings.
Thank you, Madam Chair. I asked this question yesterday to the Department of Corrections Director. And Wyoming, it says, continues to rank high per capita in suicides. I have my own thoughts about what's going on in our society. I'm wondering, since you're on the front lines, what has gone on in the last 70 years that would make children want to commit suicide? Can you give me the number one that comes up in your mind reason, and maybe kind of elaborate on what's going on in our society that would do this or cause this?
Any of you up there?
Sure, Senator Hutchings, Madam Chair. One thing that is unique to Wyoming that is sort of unique to this part of the country is things are pretty far apart. So the resources here are a little bit more limited. One of the most difficult things is to get somebody to make that call for help. And I think some of what comes with this being a frontier state is sort of a go it alone. Maybe not talk as much about some of the issues that are happening. Services are, we all know here in Wyoming, it's difficult to find services because we are so spread out. I think isolation plays a major role. I think with COVID, that certainly didn't help with children being isolated. I would say a lack of connectedness. We all know how important connectedness is just for everybody in everybody in the country, period. And I think when that is not, when that is hampered, I think it makes things a lot worse. But I think just overall, the years of the high suicide rate here is a matter of getting out there and spreading the word. And it's okay to talk about. You're not going to put the idea of suicide in somebody's head that hasn't already thought about it. I think that's an important message to get to kids as well. But it's really destigmatizing the discussion and getting into schools, and hopefully we'll have an impact with some of the schools that we're involved in going forward, even more than now, encouraging the discussion about it. But in a state which is as spread out as this is, that's a challenge.
So to follow on that, though, we're not more spread out than we were 50 years ago. I mean, the topography is unchanged in geology time. So are we stable or we're increasing? And if we're increasing, that doesn't explain, isolation, unless we've become more isolated over the last 50 years, is psychologically or.
Do you want to take that? Madam Chairman and Senator Hutchings, similar to the question yesterday, it's large. And I'll be clear that in terms of the underlying cause of suicide and suicide rates, we don't really know. That epidemiology is very hard to do. In a place like Wyoming, we could do it, and we've discussed in the Department of Health projects to kind of do follow behinds on some of these cases or attempts. And do more of what we would typically refer to as, epidemiology, almost like a contact tracing kind of thing of where did this start? What are some of the underlying causes? That would take time and would take some work to do. But I think it's very difficult to pinpoint, what causes, what the actual causation is in terms of increased rates, whether it's among youth or whether it's among, the more prevalence in a state like Wyoming is sort of in your middle-aged male categories. And there's a lot of correlations, a lot of correlative factors that that go with that, that I think people hypothesize on why a place like Wyoming or the Mountain West has higher rates than others. But I want to be clear of what we don't know and what we can't say definitively.
Just Co-Chairman Baldwin.
Thank you, Madam Chairman. I was just going to suggest, and I think they're on the right track with what they're hypothesizing, but I would suggest if you look at the top 5 states in suicide, that order has changed. As you watch that every year, it changes. We're here, they're here. But essentially that top 5 or maybe even that top 10 doesn't change a lot. They're the same ones every year. And I would suggest a correlation. What makes us similar to Alaska? What makes us similar to, and in my mind, I have some ideas. And I will ask this as a question, of course. But that's what I would suggest, and maybe looking for what are our commonalities with those other 4 people or those other 4 states. Wouldn't you agree?
And that's, and you know, we'll kind of condense this because obviously we're not going to resolve this issue really quickly, but Senator Hutchings.
Thank you. Quick follow-up. I think my question is not so much the cause, but if someone called me and said, Lynn, I want to commit suicide, what's the number one thing I'm going to ask them?
Do you have a plan?
No. Why? That's my thought. Why in the world do you want to do this? And so my thought, when I listen to you and I listen to the Department of Corrections yesterday or the comments, is there's something going on and nobody wants to say what it is. There's something going on that when these kids call you or someone calls you, you can't tell me you don't ask why. So somewhere in that list, along with the 4 other states, you would think this is the top 5 reasons people are committing suicide. My dad beats me. I'm a drunk. I gamble. I'm having sexual dysphoria. Something's going on in my mind, that something's going on. And you would think if they're calling you and you're getting all these calls and you're having such a great time with them, what are the causes or the reasons, should I say?
Senator Hutchings.
Remember through the chairman.
Yeah.
Just to keep it organized.
Madam Chair and Senator Hutchings, when we take these calls, it's very nuanced, and it's a matter of establishing some sort of a relationship with the caller. We obviously do get to why, but it's safety first. So when we get a call, we have to determine, does this have the potential to be an active rescue? Are we going to need law enforcement involved? Are we going to need to involve other folks? And it's the skill of the person taking the call that can get to somebody. I mean, there's doors that are closed and you find a way around. You find a way to open some of those doors to get some of that information. And it's different for every caller. There's no, and I'm sure Jeff and Bernice would agree, there's no boilerplate that walks you through all the questions. It really depends on the person on the other end of the phone. And what you want to do, it takes a lot for somebody to pick up that phone and make that call. It takes an awful lot to do that. And you want to be there with that person and walk them through, take your time. And I said in the past, I'm always impressed with how great the people are that pick up these calls, that can do that, that can relate to that individual. And you kind of address it. As I said, it's very nuanced and it depends from person to person.
Thank you. Representative. Yes.
Can I speak to that, please? Madam Chair, Senator Hutchins. 69% of the calls that we get, we categorize as low risk. We've actually coined a phrase, we say it's the Lonely Hearts Club. It's a lot of loneliness out there. You know, a lot of people who, due to economic hardship or domestic violence or whatever, just need somebody to talk to. The majority of our calls do not have suicidal intention. But we have done a survey in the state about suicidal ideation with the general population, and we're in the process of doing one with gay men right now. And the lifetime suicidal ideation amongst the gay men in Wyoming is 3 times what it is for the general population. So what I would take from that is people who don't fit in for whatever reason. They don't fit in with what they perceive society to be. And your earlier question about children, when you're an adolescent, you're trying to fit in, right? And if you can't fit in, it's the most horrible day in your life, that day that you don't fit in. So I think it's a lot of that. I'm not a psychologist or a
But thank you.
psychiatrist.
Thank you for trying. I appreciate that.
Yeah.
Representative
Thank you,
Flitner, did
Madam
I see
Chair.
your hand?
Yes, ma'am.
Okay.
Thank you, Madam Chairman. And as you know, I come from the world of agriculture, and I've read a couple articles recently about the rise of suicide in farmers and ranchers. And I'm just wondering if you've made that connection with some of our state ag organizations.
Please. Sure, Representative Filter. Yes, actually, on our one of our events, they approached us, and we're in the process of back and forth in emails because they have a huge Latino population as well. And my Latino population, having Hispanic heritage, but they have, again, we're back and forth with the emails. I'm not very familiar with Wyoming. I'm not going to sit here and say that I know Wyoming. From New York, and I'm very familiar with the rural in agriculture of New York because I was involved with the rural immigrants there. So I'm looking forward for them to, expand my knowledge on that. So I am in that process.
Representative Flitner, Madam Chair, there was an excellent article in Rolling Stone, I think about a family in South Dakota. It might have been 2 years ago. And he was a rancher, he was a farmer, and it talked about how he just couldn't make ends meet. And, the family that he left behind is struggling or was struggling to deal with the consequences and had no idea that he was in that space. So there are some excellent articles out there.
More questions on that? Senator Bouchard.
Thank you, Madam Chair. I just have a question just for informational. I want to know what the answer is. So what it is most suicides, people maybe saw signs, knew something, but didn't know it until afterwards. So how many calls do you get from people from another party saying, hey, I know someone that you guys need to reach out to? I mean, so I'm kind of curious if there's numbers on it.
Yes, that I consider other third-party calls and other calls. So I would, from the over 1,300 calls that I got, 922 calls were calls that were third-party calls. And some of them actually were, I would say, I had 19 active rescues. I would say half of them were active rescues. And not here in Casper. I had some that were out of state because although you do have a 307 number, they may not be located here. So I would have to work my magic to connect with law enforcement from other states. And because of my experience, so I would be able to connect. I utilize a lot of my colleagues on the East Coast to get to what I want, where I want to with my active rescues. So that's been very beneficial.
Hello?
Just a follow-up, thank you. So do you do marketing in that area? In other words, like I'm just thinking of a radio ad that says,
yes,
do you know, look out for the signs, and if you, don't let someone take that route, call in there. I mean, so are we doing that kind of?
Yes. In fact, yes, Senator Bouchard and Madam Chair, we're going to be in, where are we tomorrow?
Tomorrow we're in Sheridan.
In Sheridan, I think in a couple of weeks, we'll be in Laramie to do everything we can to promote awareness. And as you said, Senator, it's so important that people know that there is somebody to talk to. And a lot of also what we've done with the veteran population as well is people don't even necessarily know all the veteran services that are available. So we need to do everything we can to let people know what treatment is available throughout the country, not only for veterans, obviously, but for everybody. So getting the word out is really, really important. We work with the sheriff department across the entire state to try to get the word out. I will say we've had really good experience with the law enforcement throughout the state in terms of these active rescues, and the response has really been great.
Something to that.
Madam Chairman, maybe just in closing here from the department's perspective, I want Senator Bouchard, to your question, I want to let you know it's not just these folks' responsibility to promote or to handle suicide prevention for the state. And as you all may remember, the legislature directed us a couple of years ago to fund all of our prevention efforts, including suicide prevention efforts from the department, both state and federal funds through county governments, and essentially allocate that to local coalitions of folks who do that work in the communities, including promoting and awareness around suicide prevention and the Lifeline. So just wanted to make it clear that with the investment that you see here, this what the legislature allocated in the 2020 it is not the full encompassing picture of prevention. So important to remember
And to
that.
speak to that, I think it was 2 years ago, maybe we heard from the department, we got a complete list of all of the recipients of the prevention grants across the state. If someone wants that again, I can just email me and I'll recirculate it, but it's probably in a 2019 interim package, maybe something like that, if you look way back.
And Madam Chairman, we're happy to update
And,
that.
and
for
just
you.
along those lines, as far as I myself am not on social media, but those of you legislators who do Facebook or those sorts of things, you might consider putting a little notice of informational notice on your pages for this. I mean, the more you can share. Senator Hutchings. Katie. Ma'am. Oh, well, super. Representative Romero Martinez. ¿Dónde estás?
I can't really see everybody's name on the panel, and you probably see me as a really small, tiny person too. But I had a couple of questions, and I think, so I'm gonna start off with where we began. The panel had, in one of the answers, it was mentioned that we kind of addressed the sprawl and going at it alone. I wanted to go back to what Senator Hutchings had asked, and what was the #1 reason. I would even say, what are the top 5 reasons? And of course, we could speculate and hypothesize, and we probably know there was a study that came out from CU Boulder. Why is there more suicide in just Cheyenne than Boulder? We have the same temperature. We have the same almost altitude. The difference was the wind. But when we address the last 7 years, we look at all the major factors that lead to suicide. At the top of the list is a breakdown in the family, a breakdown in society, violence of some sort or the other. There's also the conversation of, well, I'll bring up the word successive suicide. Please write that down and put a star by it. Successive suicide would be a family where there's alcohol addiction or something like that, and then a child ends up dead for drinking alcohol for 2 months. Not even, or an adult, young adult for 2 months, whose organs explode. People at DFS and all around the state knew about it, but there was not an intervention mechanism. I guess my question would be, without doing the 5-minute overview and setting the co-chairs. First question would be, have you reached out to the faith-based community? In my district 44, the Diocese of Cheyenne, St. Joseph's, outside of my district, any other church, Senator Hutchings Church, there's been a disconnect with the faith community that's been addressed on the floor and all over the place. And if there hasn't been, I just want to kind of encourage that. I want to thank you for all you do. And then I'm just going to bundle it so I don't have to keep doing follow-up. Is you talked about addressing veterans, and the board addressed veterans and they don't know what they have. But have you addressed people who served in the military that aren't veterans? People who are veterans served outside of the continental United States with a gun in their hand for, there's a rule, right? 90 days or whatever it is. But there's people that have fought terrorism here in the homeland that might need support. And none of these Volunteer of America programs even work because you can't even touch them. So those are in another situation where yet another donut hole. I digress. If you could address the faith-based community issue first. Thank you.
Okay. Table, I'll just call you the table and that way you can bring in as you wish.
Well, the short answer for us is that we have reached out to some faith-based organizations. We have an advisory board of about a dozen folks from across the state. And we have a couple of folks from the Episcopal Church on our advisory board, and the Episcopal Church Foundation is one of our contributors who helps us with money. And we are going to work with them to identify volunteers in Episcopal churches across the state to augment our telephone lines and get more volunteers.
Sure, Senator Romero Martinez and Madam Chair Wilson. Yes, we have made some of those outreach efforts, and we've also utilized some of our board members who are active in their local churches to see what we can do. I also wanted to mention, as it concerns the veteran population, it's not only active veterans, and Jen Davis can also speak at some point about the governor's challenge, because she's done a tremendous amount of work with that, as the governor has, in terms of reaching out to active duty, National Guard, families of veterans, retired. So there's quite a list of the folks that we've been working with to try to promote awareness and to see if there's something we can do to promote warm handoffs for people that do call in.
Okay, any more questions? Thank you so much for all you're doing.
Madam Chair, I want to thank.
Don't give up.
And
Thank
the
you.
committee so sincerely. This is such important work, and I really appreciate the time. I know you guys are strapped for time.
I have one comment.
Bernice, yes, go
Madam
ahead.
Chairman and Representative Connolly. I wanted to go back.
Oh,
on
I'm sorry.
what-
Hang on one second, Bernice. That's right. So well, let her finish talking and then I
Sorry.
forgot about Andy. Go ahead.
On about the National Suicide Hotline and the 60% of calls. I worked for the Department of Behavioral Health in Dutchess County in New York. That's where I started my career of over 22 years. And when the National Lifeline came about in 2005, and we got connected, the unit that I worked for was Helpline. We were in existence since 1972. And we had 17 bridge phones. So I answered those bridge phones as the only Latina counselor. So I did active rescues and also with bridge phones. So the National Lifeline do have centers that are facilities. Actually, a lot of centers that do have that are facilities and are connected with the Department of Mental Hygiene, which are now called Department of Behavioral Health, which do a lot of follow-up. So I didn't want you to think that they're not being answered, or some facilities are not being followed through. So some centers are volunteers like Mr. Hennis, but some are that are just call centers, but some centers are really follow through with behavioral health treatments and stuff. So I just wanted you to not think that the National Lifeline 60% phone calls are not all, not tended to.
Yeah, and our center is not volunteer. We're looking for
I'm
volunteers.
sorry, I
but-
didn't mean.
Yeah, that's okay.
I didn't mean
But I
to say
mean,
volunteers.
we have 2 paid staffers who are answering the phones 5
Okay,
days a week.
super. Let me go ahead and put in through Andy.
Good morning, committee.
Hi, Andy.
Hi. I apologize that I can't be with you in person today. I just had some brief comments to share with the committee in terms of where we're going with 988 nationally. So the 988 came about because of the National Suicide Hotline Designation Act that was signed by President Trump in late 2020. And what 988 is really moving towards nationally is to be a better resource for mental health calls, and frankly, to try to take some of the stress off of law enforcement. and try to get those people into mental health services early by giving them a resource. Included in that discussion nationally is, of course, I'm sure everybody has heard, mobile crisis teams. That is something that's being discussed on the national level. And in terms of where WAMSAC providers are and the mental health community in general in Wyoming, from the feedback I've received, is that we need to continue to look at that and figure out what is actually going to work in Wyoming for mobile crisis. I was on a stakeholder call with law enforcement a few weeks ago, and the request from our law enforcement to the mental health providers was, we need more support in crisis. We need more support for these mental health calls, but we still need to have the conversations about what that actually can look like in Wyoming. We're certainly not able to run some of the types of programs that they can in more densely populated areas. The other piece I wanted to touch on is in terms of the 988 implementation, as you heard described by the panelists that are there in person, getting calls that are actually in Wyoming to the Wyoming call center is something that's going to be improved, hopefully dramatically with the 988 implementation. But in Wyoming, it appears that we are going to have some challenges with that. That is a very technical system, runs on digital geolocation, which is not a technology as we understand it that we have kind of ubiquitous throughout the state. We have analog geolocation in a lot of places that will make that more difficult. So there are some highly technical pieces of this implementation that we'll continue to work on and participate with the Department of Health in terms of identifying those and trying to address those in the future. And Madam Chair, the last piece that I want to touch on is funding. The Suicide Hotline Designation Act does provide a single route of funding authorization, which is a fee on telephone bills similar to a 911 fee to fund operations for a hotline center. But it is also directed to fund operations for crisis stabilization services and the personnel. So to really try to focus on that entire continuum of care, starting from when the call comes in to what Bernice described in terms of that warm handoff to the crisis center to get that person stabilized. That may be something that we would like considered in the future in terms of how to support funding to get these operations up to 24/7, but to do it in a way that we're providing that high level of service across the state and not just a call center with a referral. We really want to be able to expand that ability to provide that high level of care across the state. And with that, Madam Chair, I would stand for any questions.
Questions for Ms. Somerville? And yeah, I do have one that just came to my mind, and I really should have asked earlier, but when the 988 activates, will the 1-800-273-TALK still be functional while we work out the technology problems?
Madam Chairman, as I understand it from our federal partners, yes, but I don't know how for how long. So if somebody continues to dial that number after July of 22, it'll still be routed into the 988 system and then to the appropriate call center.
Representative Stivar.
Thank you, Madam Chair. What I'm not understanding is I've got two cell phones, 307 or 402. If I dial 911 on my 402 and I'm in Cheyenne, it goes to the Cheyenne PD. 811, if I'm calling a dig ticket in and I'm in Arizona and I dial 811 on either of these phones, it goes straight to the one call center closest to me. So the technology is out there to implement this. And that's what I'm not understanding is, have you guys worked with 811 and 911's stuff?
Andy, and I appreciate it's probably not you doing the telecoms, but
Madam Chairman, Representative Stiver, actually, it is a little bit. I've definitely gotten out of my comfort zone with 988 conversations because I am not a telecom specialist by any means. But I think Representative Stiver, you hit it precisely right in that the technology exists, but it hasn't been implemented. As I understand it, there's a lot of technical pieces that have to be implemented in the background to enable that analog geolocation in Wyoming and a lot of frankly, in most of the state, to be able to identify where that caller is at. That doesn't currently function with the 1-800 number. So with 988, that geolocation will be upgraded to be able to do what 811 and 911 can do.
Okay, any more questions? Thank you, Andy.
Thank you.
Okay. Yes, someone else? Representative Romero Martinez. Representative Romero Martinez, are you still there? Were you wanting to ask another question?
Can you still hear me?
I can hear you now, yes.
I apologize, I had mute, that was my fault. Madam Chair, my question is in regards to analog geolocation, and just as a point of clarification, is that a technology that actually locates where the individual is that's basically calling for help?
Madam Chairman, Representative Romero Martinez, the simple answer is yes. So analog geolocation is generally a triangulation of 3 cell phone towers to get an approximate location. The challenge we have in Wyoming is there's not always 3 cell phone towers to make that work. So you end up with 2, which means you end up with a giant swath of area where somebody could be. Digital geolocation is much more precise and involves technology that I would describe poorly to the committee, so I won't. But that is how that works.
Thank you. And I never wanted to serve on corporations, so let's not talk about that anymore. Thank you, Andy. Okay. I think we're done with the questions. Thank you, folks, so much. Committee, we're going to take a break until be promptly back at 1/4 till, and then we will only be 2 hours behind on today. 10 minutes, 1/4 till, be here. workers' compensation consumer advocate ombudsman follow-up. So committee, let me just remind you what we're doing with this. Back when we put together the interim topics and as we came into our first meeting, we talked a little bit about how it's kind of come to our notice that not all employees in the state are covered under the state workers' comp system. And that has two consequences. One is that back in our COVID special session, when we clarified and I'm speaking rather loosely, so probably Director Cooley is just cringing at my explanation of this, but when we clarified the role of workers' comp and COVID and that sort of thing, quite a number of people weren't actually covered by that. The other thing is that people who are covered under self-insured companies, for example, big box stores are typically are really on their own in terms of working with their employer in a workman's comp situation, unlike what happens for a person who is covered under workers' comp. And that's kind of the loose version, and we'll hear better. But so what we directed was we asked LSO and Workforce Services to give us a list of other states that had some sort of consumer advocate ombudsman type program in their states. Then after reviewing the list, which we got June maybe, or beginning of July or something like that, it looked to me that the states of Texas and Washington had programs that were most similar to our situation because they also offered the availability of not being under the state workers' comp system. So what you're going to hear today is a summary from Ms. Shippen from LSO about those two programs. We'd like to hear a little bit further from Director Cooley and the Workforce Services folks, whether they perceive something like that might fit into what we do. I have some questions about funding for a program of that type. And then as a committee, we can discuss whether we would like to pursue drafting something in Wyoming. I will say just, I know that there are a few folks that don't really like the state workers' comp system in general. Frankly, I think that topic is beyond our scope this summer, beyond the scope of a fairly new committee. That would be a huge topic. I'm not saying that it could never be considered, but I think that's beyond where we can go this summer. So with that said, that was my intro. And you have in your packet, you might actually have, well, actually I printed out one out because I needed it. But so you do have in your packet the research memo and we'll see where we go from there. Okay, Donna, go ahead.
All right, thank you, Madam Chair. Good morning, committee members. You do have the research memo. I'm not going to talk a lot because all the information that I know is in this memo. But it does look at the Texas and Washington ombudsman programs. I have a little bit of a summary about how Texas and Washington address workers' compensation insurance. And just want to let you know, if you think of Wyoming as kind of being in the middle in terms of who we cover certain high hazard occupations. Texas and Washington are kind of at both extremes. So in Texas, workers' comp insurance is voluntary for employers. About 80% of private employers do choose to cover their employees with workers' comp. And it's the Department of Insurance Division of Workers' Compensation that oversees the workers' comp program. Texas does not have a state workers' comp fund, unlike Wyoming. Instead, workers who choose to insure their employees can either purchase private insurance policies or seek to qualify as a self-insurer. In 2005, Texas reorganized how the state administers workers' compensation, and they set up the Division of Workers' Compensation within their Department of Insurance, and also set up the Office of Injured Employee Counsel to assist employees with their workers' compensation claims. And that office represents employees of both employees of employers with private insurance and employers with self-insurance. The office has a budget of about $9 million and about 175 full-time employees who are distributed around the state in the same offices as workers' comp employees are, although they are two separate agencies. And the governor appoints the Injured Employee Council, and I believe it's for a term of 2 years. That's on page 3 of the memo. And the memo just kind of summarizes the statutes that create that office, what the office's powers and duties are, eligibility requirements for the public counsel, and then the powers and duties of the ombudsman that assist employees. Washington, on the other hand, the state of Washington, and information about the state of Washington starts on page 4 of the memo. Workers' comp is mandatory for virtually all employers. And but those employers have a choice. They can either buy into the state fund or again seek to be self-insured. Like Texas, and I probably didn't make this clear, Washington and Texas both require self-insurers to certify with their workers' comp program, and they tax self-insurers. They assess an administrative or a maintenance tax, and those funds go to fund their ombudsman program. So Washington.
Excuse me, Donna, and I didn't notice this in here, as far as the tax, did you see what that was? Is it based on dollars per employee? And do you have any kind of figure to work from?
Yeah, I'm sorry, I don't have specifics about Washington's tax. I do know I did look up Texas's tax. The tax rate was 0.02%. And I'm sorry,
Of their payroll,
Madam Chair, I'm sorry, I'm going to have to investigate further to see how they're figuring that.
Okay, that's fine. Go ahead.
So-
Sorry.
The state of Washington in 2007 established the Office of Ombuds to assist workers of self-insured employers. And again, the memo on page 5 goes through powers and duties of that office. And as I said, the office is funded by an annual administrative assessment of self-insurers. Attached to the memo in Appendix A are the Texas statutes regarding the Office of Injured Employee Counsel, and then Appendix B are the Washington statutes.
Okay. Yeah, we obviously have Director Cooley and her folks here, but are there any questions specifically for Ms. Shippen? Okay. Hello, Director.
Good morning, Madam Chair, Mr. Co-Chair, members of the committee. My name is Robin Cooley. I'm the Director of Wyoming Workforce Services, and we're happy to be here today to visit with you about this issue. I also have with me my real expert, Mr. Jason Wolf, who is my administrator of the Workforce Standards Division in our office, which one of his units is the Workers' Compensation Unit. So I will turn it over to him.
Thank you, Director. Thank you, Madam Chairman, Mr. Co-Chairman. I agree with the memo that was put together by LSO, and I guess I would just kind of be available for any questions, to kind of get the conversation started. I think per our last conversation in June, I think what I got from that was we were looking for a potential for an ombudsman program to kind of oversee these optional covered folks that did not have our state coverage, if I understood correctly.
Okay. Well, I'll actually lead on. Usually I try to let other people ask questions first, but seeing as I kind of was driving this, I will ask a few and then folks can come in. So what I am considering, along with some other folks, is the potential of setting up a similar ombudsman type program in our state for the self-insured. So And the first thing I'm gonna ask about 3 questions first. And the first one is, I apologize, Director Cooley, because I think you've answered my question like 3 times and I don't seem to retain the answer. The question is, how many people in Wyoming are covered under self-insured people? You know, number of people, and I think I need to know number of people and maybe number of employers, but, and as I say, I'm pretty sure you've told me that before, and I probably write it down and then who knows what happens. So that's what I want to know first, is the numbers. Then second, and looking at the Texas and Washington, the Washington program, the statute seems a little simpler, a little clearer. There are a few things from Texas that I would maybe bring in, some, prohibitions against other having people being employed there and having represented people elsewhere, and medical records costs and that kind of thing. But so I'd just be curious as far as your input, because, my perception may not be accurate, but as far as whether it would be helpful to workers in the state to have an ombudsman program. And then, so the third question, so the first one is the numbers of employees. The second one is just your opinions on whether that would be helpful. And the third would be the issue of funding, because plainly I can't see that we would fund an ombudsman program for self-insured employees out of the workers' comp premiums that doesn't seem fair at all. So if we had to, go with an assessment on the self-insured companies, I don't know how that would, your thoughts on how that would work, whether it would be, per employee, per payroll, something like that. And then actually, I saw Commissioner Rude earlier. I don't know, there they are. We might have you guys come up afterwards, just because some of the other states, there's some supervision through Department of Insurance of, at least being aware of this self-insured companies. Those are my initial questions. Go ahead,
Okay,
Mr.
Madam
Wolf.
Chairman, let me try and unpack that a little bit here.
I want
I
to know
was just
everything.
opening up
World peace and all that sort of stuff.
the presentation that I gave during our June meeting. And again, kind of to your first question, how many employers are not covered, and how does that equate to employees? That's a bit of a difficult number to pin down. But, and that's because we only have the information that's reported to us by those who either opt in or are required. So, we can tell you how many employees we cover and how many employers are in the system. And then kind of what we look at is what is the total workforce in Wyoming, and how many employers does that equate to?
Right. I'm assuming you could estimate off of like the unemployment insurance tax payments or something like that. I don't know.
Correct. So in the presentation I gave in our June meeting, I think we kind of estimate that number of possible employees that are not covered around 23,000 employees that are not covered under our fund. That's not to say that they're not covered somewhere else. So, and I don't think I had in here how many employers that equates to, so we can get that number for you though.
Okay, so 23,000.
Approximately.
Got it. Okay.
So I guess as to the funding issue, I agree with your assessment, Chairman Wilson, that I think to fund such a program out of the work, the industrial accident fund probably is not fair to the premium paying employers. I think, looking at the way other states fund it, I would see it as some kind of either tax assessment or general fund appropriation to really make, and I think that's the twofold thing, one for the fairness for the paying employers, and two is that, so if you're going to do something like this, it needs to be impartial. And as you guys, as most of you know, I think, we pay attorneys fees for contested cases. And, sometimes we hear from other individuals that because we pay those attorneys, they're not impartial. And, the perception is definitely there that because we pay those, the impartiality kind of disappears. So I guess that would be my funding explanation. I don't really know a good way to fund it. On the flip side of that, I think there's also what we have to look at is that these people who do not opt into our coverage and they're covered by some third party, we have no statutory authority to, understand what they're doing. So to give you an idea, we hear from people like, let's use a big box store, for example. We hear from folks that might work for one of those big box stores. They call us and say, this company, what am I supposed to be paying in temporary disability? And I can tell you what you should get by state law if you're covered under our fund, but I can't tell you what you should get under this other fund because we have no authority to oversee that. So similar to the Texas and Washington thing, I think that I think for an ombudsman program to work in Wyoming, I almost think we would, just thinking it through, need some kind of statutory authority that would let us similarly not regulate, but similarly kind of oversee those self-insureds so we know who's there and who's self-insured. And are they then held to our state standards as far as, payment of benefits? I don't know. I don't think you can do that, but I think those are just some things to think about, as we work through this.
Madam Chair, I would just add to that, so statutory changes to require them to at least report to our office. So we have accurate numbers and accurate information from them, including the number of employees covered, et cetera, and how they're covered. But I would extend that a little bit further in terms of when we're speaking about the program itself. Again, as Mr. Wolf indicated, having that as an outside entity so that we can maintain that separation. And I think I talked to you or mentioned a little bit earlier from a previous life on the PSC, and they have the consumer protection side of that in a separate entity, and there is a separation there. And I understand their budget was just maybe recently brought into the PSC, but there's still a very clear separation between those entities. So I think we would need to definitely maintain that kind of it would be an entirely separate entity, I think, that we would be looking at if this were to go forward to make it
So you're
beneficial.
saying you are not sure that it should be housed in workforce services at all?
Yeah, Madam Chairman, I would leave that decision up to the committee. In my personal, I guess, opinion, and from what I've experienced over the years working for the division, is that there's a couple things that happen. So we actually, in the documentation that we sent you back in June and follow up, you'll notice we do have what we call a customer advocate to assist those folks that might have complaints about their claims analyst, or they might not know how to file paperwork. So we employ just a single position for that purpose to help those folks that, maybe not satisfied with the service they received for one reason or another. And that we've had that position since roughly 2009. I think it's been fairly effective. We do have that person engage with a lot of employer groups and give presentations to different entities on, the do's and don'ts of workers' compensation, basically. So I think there's a place for an ombudsman, but I do think that to make it, so it does not appear connected to us, I think it needs to be housed outside of our agency.
Do you have a suggestion? Have you talked to the people you're going to suggest?
Well, Madam Chairman, I don't know that I have a real good suggestion. I think just looking at some of the other states and how they operate an ombudsman program, it's, it's set up typically either as a executive function. I think there's a couple of them in the US that are actually a legislative, part of the legislative branch. I don't know the best answer to that, but I can tell you that even with the customer advocate that we employ in-house, we've tried a number of different things with that. Keeping it outside of the claims manager's purview, for example. just so that if there is a complaint, it doesn't rise up the same chain of the person that they had a problem with. And, you know, there's, I guess, pros and cons to that. And no matter what we seem to do, you know, there's always that faction that will say, this person's not impartial, despite their best efforts of trying to be.
So let me circle back on that, because I'm not sure I really understand, you know, if the company is self-insured, they're not paying to you anyway, so I guess I don't see the lack of impartiality, because you would only be helping the employee, and the employer is not actually linked to you through that program. I mean, they're obviously doing other workforce service things like unemployment insurance and that kind of stuff, but so I guess I'm not quite seeing the problem.
Madam Chairman, and maybe I kind of misunderstood, but yeah, if we're looking at, you know, just an ombudsman for those self-insured entities, you know, that housed within our agency, I don't know whether it work or not. I guess my fear is that if an ombudsman program is created, is it always going to be just, you know, if we get a call from an injured worker that is insured with us, we're going to help them. And I mean, so I don't know that we can draw a distinction between insured through the state fund and not insured through the state fund is what I'm trying to get at. I think if people know there's an ombudsman program, they're going to want to utilize that, whether they're insured through Wyoming or they're insured through a third party, if that makes sense.
And so now, I guess what I was thinking, and perhaps I'm mistaken, that if the person is insured through the state program, in a contested case, aren't we already basically providing them with legal counsel?
Madam Chairman, that's correct. So statute allows for us to reimburse their attorney fees once they've taken their case to a contested case level.
Right. So in essence, they are getting counsel just from the attorney that we're paying for. So what this program like this would be doing is just, we're not paying for the self-insured employee to have an attorney. We're just having a kindly suggesting person in the office. I mean, I guess I'm not sure that I see. Well, we can continue to go ahead.
So I guess, sorry, Madam Chairman, I guess I'm a little unclear on what we would be advising those folks on, because we don't have any statutory authority over those self-insureds. And so would we be advising them on state law per our fund? I guess I don't understand what we would be advising those uninsured folks on.
I think what I'm seeing it more, and committee, thank you for hanging with me on this. What I'm kind of seeing it as a replacement for me, which is right now people call me, and that's me to help them. And I'm not an attorney or anybody knowledgeable. You know, if a person were there basically in a sort of an advisory mediator functionality, that these are what you can do, these are where you can go, these are what your rights are. You know, and you would not have a regulatory oversight over their employer, but as people call me, sometimes in my head, what I'm thinking is you need a lawyer, and I'm not one, but the lawyers will take those cases. And so I'm really searching for some knowledgeable party to advise and just kind of help them out as a consumer assistant type of person, not go to court with them or any such thing, because you're not their lawyer, but just somebody that is more knowledgeable than me. That's kind of what I'm seeing, what I'm hoping for. Go ahead, Director.
And Madam Chairperson, now that you've kind of explained it a little bit better, I don't see that we would have that kind of a conflict, because it would be nothing about workers' compensation, right? It's about a third party. And so we would be assisting them in that regard. If we wanted to go even down the road of potential mediation, boy, I think that'd be kind of an exciting option to help them out with that. And as we know through the Ag Department, we can get people that are qualified to do mediation. I think that that's an interesting maybe offshoot of this. So I think as it's been a little further explained, I don't see the conflict. So having somebody in our office to do that, or a unit, maybe 2 or 3 people. I don't know what the need would be because we're not sure the number of employers that are in that situation, but I think it's an interesting concept as you further explain.
Oh, good, I feel better now.
Yeah.
Yeah.
That makes
Thank
way
you.
better sense. Thank you.
That's good. Okay, now, so we'll take a little break there and let people pitch in. And I don't know how many people have really had the opportunity to look over the Washington bill. I can go over that a little bit further as to what is in that bill. But let's break for questions here.
Madam Chair.
No, I think she's just had her arm up. Do I have nothing? Representative Ottman, are you contemplating something? You look like it's kind of stirring around there.
Madam Chairman, thank you. And it's just a general question because I'm not real familiar with it. With the Bureau of, you're with Workforce Services and unemployment, no, not unemployment, workman's comp. Okay, oh, good. Okay, that's what I thought. What are, if you say some are insured through the state agency, but others are insured through others, is that really you go to an insurance company and you find this is the kind of policy I want for my company, my workers? Is that what happens?
Madam Chairman?
Mr. Wolf.
Yes, and so there's the people in our last meeting, I'm not sure if you were there, Representative Ottman, but our state law spells out what we call extra hazardous versus non-hazardous. So the extra hazardous industry in Wyoming is what we call required coverage, meaning they have to get the coverage through the state fund. The optional folks that most often, probably the biggest chunk of that is your retail sector, are optional. And so a lot of the retail, like big box stores, for example, they have what's called a third-party administrator that might handle all of their workers' comp at a national level. So they have some kind of workers' comp policy or commercial general liability policy that covers all of those folks.
Senator McCune.
Thank you, Madam Chairman. Well, my question's pretty simple because I thought I understood the law. And now I'm thinking I don't, as a small business owner. As I understand what you're saying, I can go purchase my own private insurance and take myself off the workers' comp unemployment program. Is that correct?
Madam Chair, Senator McComb, I hope I pronounced your name right. McCune. So yeah, I'm not familiar with your industry, but if you're considered optional coverage, you certainly can go out in the market and buy your own coverage. That's correct.
So to be clear there, and we've been talking about self-insured, a small business who wouldn't have the actuarial ability really to self-insure could still purchase from somewhere else, a regular insurance
Madam Chairman,
policy.
that's correct. Yeah, I'm not aware of anybody that does business in the state other than maybe one of the big box retails that is self-insured.
So,
go ahead,
Madam Chairman. I'm in the grocery business and I don't think that's real hazardous. But I'll let you answer that question.
Madam Chairman, Senator, you're correct. Yeah, I think depending in the grocery stores, I believe that is considered what I believe that NAICS classification is optional coverage under the statute. And I can certainly assist you with finding that out. But if you are under that optional NAICS code, you don't have to have Wyoming's coverage. You can go to out the market and find your own coverage.
Thank you very much.
Worth the price of admission already, huh, Senator?
Not to pick on anybody, but it's kind of expensive.
Well, there you go. Okay, there you go. Any more questions for Mr. Wolf for the director? Okay, let me just brief what I'm going to end up with this then, folks, is I just want to show you kind of point through, and I'm assuming that people may not have delved into the Washington law that much. I want to point out what I think are the the grand features of the Washington law, and then I'm gonna ask people if you would be interested in having some sort of a draft to consider in November. So if you've got the LSO memo, as you continue on further back, picking up on page. Page. Very good, thank you. Yes, 18. Okay, so there's some issue, and we can discuss these later. We don't need to get into the weeds right now, but I would maybe work with a couple other folks if you're interested in this. Because there's obviously still things to consider. How, if they need another FTE, how do we pay this? How many employers would it be? Is there a fee? I mean, we obviously need to know more information. But there's some issues to dealing with terms of office, whether it's pertinent. I'm not sure that that's really worth it, but they talk about the staffing, the powers and the duties. So if you look at the bottom of page 18, an advocate for injured workers to provide information to basically facilitate resolution, a toll-free number, refer complaints. Okay, then there's some, discussion about page 19, communications being privileged and that kind of thing, posters and brochures, and they talk about the funding and the report. I mean, it's fairly brief, which was something that attracted me about it. There are a few other things in the Texas law. I'm just backing up now on page 17. It talks about costs for medical records. I take that under advisement whether we want to do that. It fleshes out their idea of, communicate, that they're authorized to communicate with insurers or with employers and that kind of thing. The authority to assist people. Page 12 clarifies that the public counsel, in this case, it's called public counsel in Texas, may refuse to provide or may terminate services to someone who's abusive or violent. I think that might be helpful because some of these people are very crabby. Fairly enough, seeing as their arm is broken or something, but still. And page 10 has some prohibitions against, kind of conflict of interest type of stuff. So those things might be worked in. So I would be glad to hear folks' input on whether we would want to draft something like this. And I'll just say, I don't want to make it sound like it's just a project to save me from work, because as legislators, as elected representatives, I mean, it is our job to help people. But you have to admit that most of us are not probably the most knowledgeable person on the other end of the telephone when you get into situations like this. And I feel like with the state this big and with 23,000 people who are kind of the first kind of the little person facing their large employer, that to just have sort of a informational advocate / mediator would really be a benefit to employed people across the state. And that's really just where I'm going. So I'll take input. And then I'll ask for discussion later. Representative Connolly.
Thanks, Madam Chair. I'd like to go down this road and just take a look at it. For me, the issue became really relevant or important, or I didn't even recognize it until a special session. And in the special session, if we remember, what we did is we passed a bill that allowed for employers who had sick employees to have it be per se COVID and go under workers' comp. And that actually helped employers because the alternative would have been UI and unemployment insurance. You had the whole issue then about what would happen to unemployment insurance rates, where workers' comp, you don't have the same amount, and it also gave more protection, right? It was a win-win, honestly, in that bill. And we came to the recognition that, okay, this might cover even the majority of workers in the state, but not all of them, and not an insignificant number. That 23,000 I think you gave us wouldn't be covered by what we did in the special session. And honestly, we couldn't figure it out. We just had to leave it as such. I'd like to try to figure it out a bit and try to give at least an avenue for those workers to be able to understand what is possible for them. And a call to an ombudsman, right, might be a part of that answer. So I'd like to take a look at it.
Any other input? Representative Hallinan.
Thank you, Madam Chairman. I hate to be the one that always says no, but I guess I don't think this is a very good idea. I think that the person needs to have an attorney. He needs to have that be his representative. And I don't think that this ombudsman would really help in coming to that conclusion. So I think this would be an added expense that we'd be putting on these employers. And I don't think it would really benefit the employee. I think if we want to make it, I don't know whether we can make it a requirement that all employers would be part of our workman's compensation program. I think if it's possible, that would answer the issue that my colleague from Albany County stated. But I don't think that this would really help the employees to have this. I think it would be just an added expense, an added item in our state government. And I'd be against this. Thank you.
Senator McCune.
Thank you, Madam Chairman. And I'm having a hard time wrapping my brain around this also. And I'm almost coming to the conclusion, we're sort of forming a statewide union to protect all employees, but they're not going to pay union dues. We're going to pay them with taxpayer money. And that's kind of the correlation I see here. So I'm going to ask you, am I all wet, or is that there's some reality to that? Thank you.
Mr. Jason, it looked like he was looking at you, Mr. Wolf.
Yeah, I think that was for me. So, Madam Chair, Senator, I think that was kind of, what I was having trouble understanding up front until Chairman Wilson explained a little bit about why what we're looking for is to help those, 23,000-ish people who are not under our fund. And again, I don't know what the right answer is to pay for it, but I agree. I don't think it should be paid for through the industrial accident fund. And what's left after that? Is there a tax, or is that a general fund appropriation? I don't know, but I don't know that that answers your question or not.
Director Cooley.
Just to further respond though, as well, there are states that have mandatory coverage for all employers. I don't know how many those are, but that is an option that other states have done.
That, Madam Chairman, I would just add to that, and good point, Director, that most of those states that do have the mandatory coverage, and I think last time, just to kind of go back to our June meeting, there's 4 states in the union that have what we call an exclusive state fund, and that is Washington State, Wyoming, North Dakota, and Ohio. And they, most of those, they have some form of what we're talking about here is self-insurance. So they have, a particular unit that, gets those applications for self-insurance. They examine the, financial solvency of the company. Can these guys self-insure, et cetera, et cetera. Obviously, we don't have the manpower to do that. We don't have the expertise in-house to do that. So to mandate all coverage, I don't know. Again, is that the right answer? I know a lot of folks with the retail industry, they enjoyed, not having to be a part of the program. And so, again, just food for thought.
So just to respond to that, Senator McEwen, we have a lot of ability in the state for people to basically complain or seek assistance. The Public Service Commission assists with keeping utility rates low. If you have a complaint about your doctor, somebody you can call in the Board of Medicine. I mean, there are a lot of ways in which we attempt to help the citizens. And really the reason that I was going with something like this is that in my mind, it does maintain the ability for people who want to be self-insured to do that. And this, I mean, I frankly don't want to go down the road of mandating everybody to be covered under the state system. So I considered that this is sort of a way of helping the person, the employee who might be in a pickle without coming down on all the employers with the full weight of, well, you got to do it this way. And I will just say, as far as the attorney things, and I don't know, Representative Hallinan, maybe nobody has called you for help on this, but I spent hours calling around to various legal aid, UW Law Clinic, all sorts of places, and pretty much the answer that I get was, we don't do workers' comp cases. So I think the thought that $15 an hour person ought to go out and out of their pocket find a lawyer, I'm not sure that that's realistic. But that's, I don't want to, I'm allowing people to ask questions and say, so Representative Ottman. Oh, sure, go ahead.
I would agree with what you're saying. And once again, maybe I don't have my brain wrapped around this, but this seems like more of an issue for the insurance commission and not necessarily our state workers' comp unemployment people.
Well, we can ask them to comment after, but because they are involved with workers' comp topics already, I figured they would be more knowledgeable. But that's, we'll get, maybe we can get the insurance folks to come up after.
Yes, ma'am.
Representative Hartman.
Madam Chairman, as you can tell, I was at that meeting, but apparently I didn't understand it. Could you please give me an example of what these 23,000 people look like? Because I just can't seem to understand who we're talking about and where they're currently going. And if someone gets hurt in an industrial accident, that they're not covered. I've had that experience.
Madam Chair, Representative Ottman, yeah, so I think, again, in general, probably in Wyoming, I would say the biggest sector of people that are not required to have our coverage is retail. And so if you think of the big box stores around the state, most of those people, again, they're covered. They are covered either by a self-insured big box store, or the big box store has what we call a third-party administrator, which is typically a national insurance company that covers their people in Wyoming as well as California, North Dakota, Utah. If that makes sense.
So Representative Ottman, maybe, I'll try to tell, so I've had several calls from more than one person, but I'm gonna try to strip out all the identifying things I don't want to say on TV, complain. I mean, because I really only heard this person's one side of this person's issue. So the first person who called me works for a large, like a warehouse type thing that ships for a major retailer. I think the person I don't know if they ran a forklift or, some sort of thing like that. Was somehow injured his arm significantly, needed surgery. So the employer paid for the surgery. I'm not saying that they just threw him out in the street, paid for the surgery. The employee didn't have a great result from the surgery, was trying to go back and get a follow-up. The employer said, nope, you're done, show up back at work. And this is from what the person said, show up back at work or you're fired. And the person said, but I can't move my arm. I can't feel my arm. I'm afraid I'm going to lose my arm. And where is he now? I mean, what happens to him then? He's going to lose his job. He can't go back to work. I'm just saying, we can't solve this man's problem from here, right? I cannot solve his problem. I don't know. I spent hours trying to help, and maybe he was all messed up. Maybe he was a jerk. I mean, I don't know. Right. So that's one example. Senator Bouchard.
Madam Chair, that's a great example. And that's exactly going back to Representative Hallian's case, I mean, we can't solve it. And someone else in the government can't solve it. And I can tell you that if somebody comes in like this and they go to an attorney, they're probably gonna have a good case. And they probably have an attorney that will take it on a contingency basis. And that's because that's what we see in business. That's how it works. And that's how those cases get escalated. So that one example does not convince me.
I'm just telling you, the attorneys I called said they don't take workers' comp cases. So maybe, okay, anyway,
Let me
we
follow
won't,
up.
Representative Connolly.
I wanted to follow up.
Oh, go ahead.
Chair. So if you have a problem in the real world, you will find an attorney. I mean, they work for money. That's what they're there for. And you probably can't find an attorney when you're trying to solve it on the level that we were doing it. But if someone on the outside wants to find an attorney that does that practice, they will find one. I mean, the way they work is they could even go to another state that has an attorney that's very well versed, and they partner with an attorney that's local, and they will all work in contingency, and they will get that. Somebody, like I said, somebody comes in, has a real case, hey, my arm doesn't work. I will guarantee you there's an attorney that will do that case. I mean, it's just too cut and dry for the story that you told me. Now, I'm not talking about anything else, but that one, so anyway, how.
Representative Connolly.
Thank you, Madam Chair. And Representative Ottman, I just wanted to add to the answer to your question, because in some ways, I think your question that you didn't understand how this could happen is honestly how most people, including workers, think about what happens when you get harmed on the job, and that you're covered by workers' comp. And that part of the issue, for me at least, is that somewhere around 70 to 80% of workers in the state are covered under a workers' comp system. Something happens to them, they call the Department of Workforce Services, who then works with that worker, works with the employer. There's a workers' compensation fund. They have a kind of straight, streamlined process for taking care of that workplace injury. That's what workers' comp is all about. But we've allowed the option that some employers don't have to participate in workers' comp. And instead they can do what's called self-insurance. Those 23,000 workers are under that system. What happens with them, it is up to the employer what they want to do. They might allow for one surgery. They might allow nothing. So what happens when that injured worker still has problems or isn't satisfied? The only alternative they have is to hire an attorney and sue. The 80% of workers who are under workers' comp, they don't have that option to hire an attorney and sue. It gets done through the workers' comp system, and that's administered by DWS. So what the attempt to do here or in other states is to say, okay, this 23,000 people, we don't want to wholly ignore you, because 80% of workers in this state are not ignored in this kind of situation. So what is it that we can do? And we look to see what other states did. So that's what's going on here in part.
Okay, any last questions? Representative Hallinan.
Thank you, Madam Chairman. I have a question. Now, if a person operates a forklift, are they considered to be like a grocery, like a clerk? Or do they have to have workman compensation coverage for them?
Madam Chair, Representative Hallinan, that's an excellent question. So the statute that governs the coverage, there's basically what we look at is the primary revenue generator. So for example, a grocery store, while it may not be required coverage, and they do some pieces of hazardous activity like operate a forklift, if that grocery store owner hasn't elected coverage with us, then they wouldn't be required just because they're operating that forklift. We look at what is the primary revenue generator and what is that NAICS code. So another good example is like a hotel. Often a hotel has an eatery in it. And the, eatery is not, the hotel's not required coverage under a NAICS code, but the eatery is. And so, there's lots of different things like that, but the primary revenue generator is the hotel, not the eatery, so.
Okay, thanks.
Someone is online? Okay, who's online? Representative Romero Martinez.
Thank you, Madam Chair. I guess make a point and then I might have a question. I don't know. If we're discussing the issue of those who are trying to be, well, I guess here's the question. If we're trying to help the people who don't have insurance and we're actually dealing still with healthcare. We voted down Medicaid expansion by 1 vote last year. How are we not, I guess my question is, why would we not help those trying to help themselves? Isn't that being independent? That's my first question.
So just to be clear, healthcare insurance does not typically cover workplace injuries because you're supposed to file those under workers' comp. I'm not sure that the Medicaid, but did you have another question?
Thank you for point of clarification, Madam Chair. The other I guess this one's more of a specific question. There's a company operating in the state of Wyoming called Craftco. They do road tar. It's a labor kind of intensive. There's a lot of fumes. Is that company considered extra hazardous?
So Mr. Wolf, I'm sure isn't going to speak specifically to any individual company without looking them up, but perhaps you could give us an oversight of the extra hazardous categories.
Yeah, thank you, Madam Chairman. Representative Romero Martinez, I would have to know the NAICS code of that employer specifically to look and see whether it's under statute as required or optional. In general, kind of going back to the forklift use, in general, if the business is using forklifts and that's their primary revenue generator, they're going to be probably required coverage. So what you explained to me sounds like they are, but I couldn't say specifically without knowing the NAICS code.
Senator Bashir.
Madam Chair, I think when I look at this as a legal problem, and I'm not a lawyer, but what I see is the government asking questions and saying, what happened here? What happened there? And and maybe when they discover something, it becomes public record. And now you've got a company that if something did go wrong, they could discover something that they probably shouldn't have known if they're going to defend that person in a legal case. So I think it gets into a hairy area where one, let's say the person says, yeah, it was my fault. And then he tells somebody who's in the government, and now that has to be discovered. And now that's discovered by the person
next time.
represent that person. And then now it's beat their case because they told the government something that they shouldn't have said. So I'm just worried about.
There is some things in the Washington law about confidentiality and that sort of thing. Okay, so that we can kind of move on. I would like to see hands for people who would like to have a draft to consider further for November. So we have something actually in writing. Any down there? 2, okay. If I may make a little cranky statement, when these people call me, I will refer them to you. Very good. Okay. Thank you, Director. I appreciate your efforts. Okay, review of safety net programs. Would you like to just stay up here and plunge into safety net programs while we're at it?
Madam Chair.
Okay, go right ahead.
Do I have anybody joining me?
There were a couple. Anyone else who's got safety net? Director Cooley feels lonely. Come on up.
Please.
They weren't ready. We're only an hour and a half behind schedule. So now they didn't think they were gonna have to come up yet.
Well, thank you, Madam Chair, members of the committee. I have provided you with what we believe is a pretty good list of our safety net programs. Now, in discussions with Chairman Wilson, I think the request was really more related, I believe, to general fund programs, but we also decided to, because most of ours are federally funded, we expanded it to that because this will provide you some really good information, I think, on programs that frankly, I don't think a lot of people know are out there. There are programs that we institute and implement in our workforce centers across the state. We've got 20 of them. And they're kind of, some of them are very small, benefit maybe only 1 or 2 people. Most are federally funded, as I indicated. We've got some vocational rehabilitation programs that have some general funds, small amount of general funds attached to them. But again, the remainder of them are federal funding. So I think what I'd like to do is just ask if you've got any questions about the list that I did provide. I don't have any specific to call out to you.
Director Cooley, I think it would be a good idea to just at least briefly go over the pages because people don't always have time to look at the whole list.
Certainly. The first one on page 1, number 1.
Oh, and let me just, I'm sorry, one other. So committee, one of the reasons, and we actually had this topic on our interim topic list in 2020, and just what with COVID and all that sort of stuff, never got to it. And the reason we put it on is that since the beginning of the budgetary problems in 2015, 2016, there are a lot of programs that we have had to cut. Sometimes you see amendments on the floor, during budget session or that kind of thing, to add money into a program here, a program there. And on the fly, we don't really always know what the other programs are, what the base amount was, whether we're aiming for a bigger number than we ever had or less. And I just felt that as a committee, that we should at least just make sure we understand what the programs are, where the funding has gone, say over the past 5 biennia. And then if it seems useful, we could even condense this into maybe a 3-pager for all of our legislative members to understand what the programs are. One, just so that we know what we're doing when we make kind of random floor amendments. And also that way, when people call you, don't just refer them to me. You will know what programs there are. So go ahead, Director. Thank you.
Thank you very much. First, our Division of Vocational Rehabilitation, we've got members all around the state and our workforce centers and elsewhere that are providing services to individuals with disabilities. As you can see from the list here, it's a very expansive list. Career counseling, work-based learning experiences. We have a very good experience out there, collaboration with the University of Wyoming in their makerspace for individuals with disabilities. So that's an incredible program, very active in our state. And again, it's 79% federal funded and 21% state funds. And then I've got the funding sources there for the fiscal years. Pre-employment transition services. This is what we call pre-ET services. This service is generally for potentially eligible youth. For instance, if you have an individual in high school that we get a call from a counselor that says, hey, I think there's an issue here. I think there might be some issues that need to be addressed. They may not be qualified just yet for vocational rehabilitation services, but we just get the notification that there's an issue here. We can provide them with services, again, workforce readiness training, instruction in self-advocacy and peer mentoring. This is for 16-year-olds, but less than 22-year-olds. So it's really that younger generation so that we can, this is the program that we try to reach out to individuals so that they don't get lost in a system. They aren't dropping out of school. That we're providing them assistance so they can get into a career situation or a skilled workforce situation. So they're not just lost. And again, that funding is listed there, and that is, again, 79% federal and 21% state funds. And again, this is one of those makerspace programs. These are some of the individuals that were in the makerspace programs through UW. We had five pilot programs around the state, was really well received, and we hope to expand that much more. So for instance, you've got individuals in a difficult situation that can go into these makerspace, take advantage of 3D printers, learn how to use them, learn how they can be used in a workforce setting, and get all kinds of career development ideas, what they want to do when they grow up. Number 3, supported employment services. This is really a sub-grant of our vocational rehabilitation services, and it's for those individuals that have more significant disabilities. This is a long-term assistance program. We generally contract out for these services, but it really is to follow them for a longer period of time, to really provide one-on-one assistance to them, again, for some of these life skills and support services that they so desperately need. It's 90% federally funded and 10% state funds. We've got the funding source amounts there. And I want it with these amounts, please recognize that we did not have time to break these amounts out into administrative dollars and service dollars. But I will tell you, the administrative dollars are high because we do have 20 workforce centers around the state, and we're trying to provide these services across our rural state. So we've got a lot of people, not a lot of people, I don't want to say that. We've got people across the state that we're paying for with these funds, so we can make sure that they're equitably spaced around the state. The Wyoming Telerelay and Deaf Services, or the TRS program, just had a meeting with them the other day to determine what the cost is. This is a program that is collected mainly from a monthly surcharge on all commercial and private phone lines in Wyoming. As you can see, the amount has gone up here. What they looked at doing this past meeting was looking at more, and the equipment for this program is fairly expensive. So they're looking at buying more of that equipment to provide to more individuals around the state with that funding. And I'm going pretty fast, so please stop me if you've got questions. The Business Enterprise Program, or the BEP program, again, another program that's part of our vocational rehabilitation program. This program is really to help individuals with disabilities become self-employed. There's been some really significant success programs with this program. We've got one individual that was actually able to buy a food truck and started a food truck business in Cheyenne. So that's just the kind of service, to allow individuals to really get out there, see what the options are for them, and to help them move forward with a career to be self-sufficient. This is funded through, I don't know if you knew this, but when you go to the Capitol, most of those vending machines in the Capitol are owned through this business. And the funding, when you buy a pop through those vending machines, part of that goes into this program. So there is mostly federal funding, but there's other funding too through those vending services in the state buildings. In the Independent Living Program, this is a program across the state, again, that's to try to help keep individuals in their homes. So that's a diversion program from nursing homes and youth transition services. The services are cross disability and cross age. And again, independent living to help people stay in their homes and not be institutionalized. The funding there is 90% federal, 10% state funds. Another point I want to make with that is we're kind of a pass-through entity with these funds, and the funds go to 2 different centers that are across the state to assist them. The Independent Living for Older Individuals That Are Blind program, again, a program for those individuals with severe visual impairment, 100% federally funded, and the funding sources are there. And this is just to help individuals around the state that are blind cope with daily living activities and maintain independent living skills. We then have the Wagner Pizer and the Migrant Seasonal Worker Program. Now, the Wagner Pizer is a program that is maintained in all of our workforce centers around the state. When we have, I think you all have heard of the Workforce Innovation and Opportunity Act, or WIOA. The WIOA program has specific parameters. That's a federally funded program, specific parameters around it for individuals that are eligible. What we do is we look at individuals that come into our workforce centers first for WIOA. Can we provide you, do you fit within these parameters? If they do not, we have the Wagner Pizer program that can help any individual, any one of us could walk into the workforce center and get assistance with job coaching skills, soft skills, getting onto our Wyoming at Work website to find jobs. It's basically for anybody that walks into the center that doesn't otherwise apply for some of these other funding sources. The Migrant Seasonal Worker Program is the program that assists the migrant and seasonal worker employees that are engaged in farm activities to be economically self-sufficient through their employee and referral to training and other sources. So it's really, if you come here as a migrant worker, we're there to help assist you with some resources to become self-sufficient. 100% federally funded program. Foreign labor certification, H-2A temporary certification, and foreign labor housing inspection. This is one of those smaller programs that I don't think anybody really recognizes, maybe out there around our state. Foreign labor certification, we're just certifying individuals to support the hiring of foreign workers by Wyoming employers. This only happens if we cannot find workers in the United States. If that is the case, then foreign workers are considered, and we help with that certification process to bring them in. H-2A temporary certification. This is mainly for agricultural workers. If there is an anticipated shortage of workers in that area. I do want to add, though, it is not only for agriculture workers, it is also for temporary and seasonal workers. So we do get some of these H-2A workers, for instance, in the Jackson area in Teton County, to assist with the workforce there. Foreign labor housing inspections. This is an inspection process where we go out and inspect the housing that is provided to foreign workers. I used to, I grew up in Powell, and I the sugar beet industry is there, and I recognize that there is a need oftentimes to go up and inspect some of those housing opportunities for them to make sure they're appropriate for them. And we do have one person certified in each one of our workforce centers to do that work. And it's 100% federally funded. Here's where I talked about the Workforce Innovation and Opportunity Act, WIOA. This is really one of our largest programs that we implement around the state. We have 3 different classifications of individuals that we can assist around the state. That's the dislocated worker. That is any worker, for instance, coal miners that are laid off. That is any worker, no matter what their income source is or income level is, that has been dislocated from their employment. They can come into a workforce center. They're assisted with career readiness skills. If they need training in another program, we can assist them and walk them through that entire process. We can connect them into our community colleges where they can upskill or take the, or we might assist them to go get into a CDL training program that we've got several around the state that we're helping to fund along with our community colleges and our training centers across the state. So those dislocated workers have a lot of opportunity. Our funding sources, as you might imagine, from this past year have dwindled dramatically. And we're hopeful that the Department of Labor comes up with some additional funds in this area because those are the individuals we're helping that have been unemployed from the pandemic. The adult, there is the adult worker, that there are income levels to that particular program. If they come in, they've been unemployed, but are not necessarily qualified under the dislocated worker section of the grant. We provide funding there. And then we have the youth that we provide across the state assistance to. Our main focus with our youth funds is on out of school youth. those individuals that have quit school or that are actively thinking about quitting school, and we hear about it. If we can, again, grab a hold of them before they go down some other road, we can help them with career readiness. We can help them get training and get some skills to really get into a career that they're interested in. It might be a CTE or it might be a STEM. It might be any number of things around the state that we can help them with. But that's a pretty significant program, I think, for our youth around the state. Next, we have the Trade Adjustment Assistance Act. We only have one individual in that program now, but that's if we've had individuals that have lost their employment due to trade issues that we hear about. So we don't have a lot in that ever, but it's there and available in case it's needed. Next, we have the Jobs for Veterans State Grant. We have our DVOP, or our Disabled Veteran Outreach Program, where we assist veterans with the same type of career and training related services if they need those services across the state and are facing significant barriers to employment. 100% federally funded, and that is a very active program across our state, as you might imagine. Personal Opportunities with Employment Responsibilities, or the POWER Grant. This is actually TANF, also known as POWER, and it's 100% other funds. We work with DFS on this as well. It just provides services as this is the program that used to be called welfare. It provides services to individuals, parents, or other caretakers to make good decisions concerning their family's progress towards self-sufficiency. The Work Initiative Network, you may have heard this mentioned maybe a couple of years ago. We were piloting this project with DFS, the WIN program. This is really where we're working with courts across the state and individuals that owe a child support obligation. If it's a voluntary program, the requirement goes right into their child support order if they agree to do this. And what we do is we help those individuals maintain or obtain employment in order to make their child support payments. It's been very successful, and we are hoping to expand this along with DFS. It's a DFS program. We're helping out with it. We're the employment side, of course, the workforce side. We're hoping to expand this across the state because it has been so successful. Dad's Making a Difference. This is a wonderful program that we've got and has been making a huge difference for a number of dads. Again, individuals that have obligations that they're not able to currently meet, they get into the program. We provide them training. We provide them with all kinds of life skills so that they can, the most recent one, it was kind of pretty remarkable. He talked about how this impacted his ability with his children, and his children looked up to him because he was able to get through the program, and he became employed and was doing very well. And we have a graduation ceremony for those individuals, and it's a very successful program. Again, 100% other funds through the TANF block grant funds. And last but not least, we've got our Supplemental Security Income Program. Provides monthly payments to adults and children with disability or blindness. Again, there's income and resource levels for that program. It is 100% federally funded, and it is an eligibility program. So very quickly, that was a run through of our, and I will tell you, I hope we've got them all on here because we've got so many programs that we implement. So.
Questions for Director Cooley? Representative Flitner.
Madam Chairman, thank you. Director Cooley, back to number 6, the independent living program. So for instance, your senior centers, are they the ones that would utilize, say for instance, in Northern Wyoming, somebody director of senior center in Powell, would they contact the Lander office in order to tap into the services provided by this program?
Well, again, the funds go to these specific centers right now. The Wyoming Services for Independent Living on the western side of the state, and the home office is in Lander. And then the Wyoming Independent Living Center, which is on the eastern side of the state. So if they wanted to tap into those, they would contact them. The availability of funding outside of those particular areas, I don't know. But yes, I would ask them to give a call into these centers to determine if the funding was available beyond their individual regions.
Follow up. Thank you. So Director Cooley, thank you. So I'm just curious how it would work then. So if you're in Western Wyoming or Eastern Wyoming, you've got these two locations. I'm just curious how it works in order to keep people in their homes. Say, for instance, if they're in Powell or Evanston, or Burns or something. I'm just, how would that work? How would you assist those people in those communities? How would those two specific locations?
Madam Chairman. Representative Flintner, it's my understanding, and I apologize, I'm not in the weeds with the program. It's my understanding that they have individuals that go out into the home, out into the communities. If there's a need to go to a home, they go into the home and they're providing services in the home. And I can certainly get you more specific information. Again, I'm not in the weeds on a lot of these programs, but I can sure get that for you.
Okay, thank you.
And there are probably other programs through Department of Health that are similar, so we may hear more about those later. Okay, any more questions for Dr. Cooley? Thank you so much. That was very informative. I wonder, we might actually diverge. Do we have, is it Christy Arneson that's online for this, for DFS?
Good morning, Madam Chairwoman. I'm here.
You're very alert. Good for you. Okay, folks, here we've got from DFS.
Good morning, Madam Chairwoman and member, I guess it's afternoon. Good afternoon, Madam Chairwoman and members of the committee. Christy Arneson, Senior Administrator with the Department of Family Services for the Economic Security Division. I first will start by letting you know that Director Schmidt regrets that she could not be here today with you, but I'm happy to be here and discuss this topic of safety net services, or what we will call community-based services. And first, before I dive into the programs specifically that are offered, I would just like to reiterate a few things that I believe Director Schmidt has spoke with you about potentially earlier this year, which is the Department of Family Services really has three core values. The first one really is safe at home, in which we believe all children and adults deserve to live and be safe in their own homes. Secondly, we believe all families deserve a fair chance at success, and that it is our job to promote family strengths and provide access to supports that allow families to stay safely together. And then finally, it's really looking at supporting the people who support the families. And so that really is the staff of the department, as well as our partners across the state of Wyoming. And really, they are our greatest resource because they are serving the families directly in their communities and helping them get the services that will help them continue to be stable. I believe Director Schmidt has also mentioned an agency-wide vision known as Why Home Matters. And really what that vision is doing is promoting a prevention-oriented child and family well-being system, which empowers those families to travel a path that is self-sustaining. So when we talk about these safety net or community-based services, we're really looking at that through a prevention lens and really identifying those as primary prevention, in which the goal of that is for families to thrive at home. So when we talk about these services, we're really looking at the majority of them providing short-term assistance with basic needs that allows families to remain stable. The community-based services also allow these families to retain control of their decisions and typically require very limited formal contact with the Department of Family Services and other arenas such as our child welfare program. The services are, we believe, a foundation of ensuring safe homes for children and vulnerable adults. So when we start looking at we provided a document, Madam Chairwoman, outlining the programs, orienting you to that document. The first 3 pages provide an overview of each of the programs. Pages 4 and 5 are a breakdown of each of those programs by table with the data of the recipients or households served, along with the dollars coordinating with that. And I will also say, and I'm happy to, Madam Chairwoman, if you would like, walk you through each of those programs like Director Cooley did. But I will also mention that each of these programs, like I mentioned before, really are those that are providing basic necessities that we believe are essential to family stability. And I will say this last year and a half, as we've gone through this pandemic, the majority of these programs have also been infused with millions of dollars from the federal government and from each of these federal programs. as they are recognizing the importance of these services for families to remain safe, healthy, and stable. So at your pleasure, Madam Chairwoman, if you would like, I would be happy to walk through each of the programs at a high level in the document and then stand for any questions.
I think that would be great. Just a brief walkthrough of each one to make sure that we've touched base. That would be great.
Thank you, Madam Chairwoman. First, you'll see on the document is our burial program. So the burial program is created within state statute. It is a 100% state generally funded program. The department is able to assist families with the burial if the person who has passed away, when they have passed away, had been receiving TANF, which you heard Director Cooley talk about, our POWER program, which is also our cash assistance program, if they had been a recipient of Medicaid or Social Security. As Madam Chairwoman had spoke about when we talked about budget reductions, this program was actually a program that was eliminated by the Department of Family Services during the last budget reduction. It was a 100% state general fund, so it was put on the elimination. However, during the last legislative session, it was a bill was passed essentially to revive this program. Additional fees were added to the death certificates, and out of that revenue is the creation of a fund that will allow dollars to come to the Department of Family Services. And then a portion of that fund will also flow through to the Wyoming County Commissioner Association for the counties to continue to pay for burial services. And I believe it is on page 4, you can see the breakdown of that 100% state general fund. And we have gone back to 2012 to date to provide that information. The next one on the list is the TANF cash assistance, which I spoke about, but also Director Cooley has spoken about as well. So this is cash assistance. And this is really a pay after performance program. So really we're promoting self-sufficiency, improving family stability, and this is really through employment and training. So these families are going through the program and they're working with the Department of Workforce Services in order to secure employment. And we've also lined out at a very high level. This is an eligibility based, as was the burial program, it's an eligibility based program. So you will see at a high level the criteria that we look out for determining eligibility. This is a program in which we also received additional federal funds, one-time funds for COVID purposes that we have done some additional payments out to families. Child care assistance is again a program, an eligibility-based program, providing access to childcare to low-income families. And we provide this by paying directly to their childcare provider. This really is to ensure, and as I think we have seen over the last year and a half, how important the childcare infrastructure really is in order to allow people to continue to go to work. So this program is really there to allow for parents to continue to go to work or secure employment, to continue through some type of job training, or even to receive a certain level of education. This funding is, we have a child care development block grant. So a large portion of this money comes from our federal block grant. There are state general funds infused into this program. Excuse me, this is also an area in which we have received a very large amount of money related to COVID. At this point, it is probably near over $50 million that we have been working through. A lot of that dollars is going towards direct assistance. So that's helping pay to continue to allow families to be able to continue to pay for childcare, but also to help those providers of childcare remain sustainable and continue forward in their business. Child support. So child support is going to be a little bit different than all other programs, but it is also a community-based service and one we would consider a safety net. Excuse me. Child support, while it is not an eligibility-based program and is not a program that would be considered public assistance, as there are no federal or state benefits going to the families, but really what it is an essential tool for children to receive the necessary financial support that helps meet their basic needs and keep them secure and stable and safe. So the child support program is state administered. We contract throughout the state for services in the 9 judicial districts. The services include location of non-custodial parents, establishment of paternity, the enforcement of a child support order, modification of an order, and then the collection of the child support payments. You will see the breakdown, which will look a little bit different than the other tables. The breakdown on this provides you with the collections, so how much the program has collected, which means that's how much money has gone to the families in Wyoming that are owed child support. And then you'll see on there the breakdown of our expenditures, state general fund, and then this is a program in which we receive 66% federal reimbursement for what we spend. Director Cooley did mention, and I will thank her for that, is an exciting program that we are very proud of, the Work Initiative Network, which we also call WIN. Director Cooley gave a great breakdown of that. Really what we're looking at here is what we know is a lot of parents who aren't able to pay their child support are unable to do it because of different barriers, and a lot of those barriers are preventing them from employment. So this program is really looking at to identify those cases that are ripe to join the WIN program. And it is working to help them in partnership with the Department of Workforce Services. And we're also partnering for case management training with Esther, who is a training arm of Climb Wyoming. And they are voluntary, but they're also court ordered. So we have judges across the state in which they can be court ordered into this program. The majority of them at this point in time are court ordered. We do have some voluntary. It's currently in pilot. We are finishing the pilot next month. And it's currently in pilot in Campbell County, Laramie County, and in, it's in Gillette, Cheyenne, and Lander. We are looking at the beginning of next year, a rollout to get this program statewide. And just for numbers purposes, because I think it's important as we say it's successful, what we have seen for those that are in the program, we look at 6 months prior and then 6 months after if they are there yet. And we are seeing a 17% increase in the amount of current support that they are paying towards their child support. And that is a very large number when we start talking current support. So the next one on here that you all are probably familiar with is our Supplemental Nutrition Assistance Program, SNAP, also formerly known as our Food Stamps Program. So this is here to for low-income families to improve, increase their ability to buy quality foods, intent of improving their overall health, safety, and stability of the families. They receive all of their benefits on an electronic benefits card, an EBT card. The benefits that go through SNAP are 100% federal dollars, and those federal dollars actually never hit the budget of the Department of Family Services. The only dollars the department receives are some other grants that come through FNS for other programs, as well as administrative dollars to run the program. But the dollars that you will see in the chart that I believe are on page 5, the beginning of page 5, are 100% federal dollars that go directly from the federal government onto a person's eligibility, onto their card once we have determined their eligibility and the amount that they are eligible for. This arena was another arena in which we have received a large influx of federal money. And we have received it in the amount of, well, it's emergency assistance. And what that has allowed us to do is if a household is eligible for SNAP, they are moved up to the maximum allotment or the maximum benefit for their household size. So there are different criteria that are not taken into place right now that typically would be eligibility wise. That started per federal regulation in April of last year, and it is continuing today. Another portion of this is not, if you have heard of it, it's not directly SNAP, but it has been given to us under Food and Nutrition Services, which is the same federal agency that administers SNAP, is Pandemic EBT. And these are additional food benefits to children who are eligible for free and reduced lunch. And this is to get them additional food benefits when schools have been closed. So this dates back to when schools closed in 2020, but also has gone forward through 2021, and it will continue to move forward through 2020, right? This school year, the current school year that we are in. Homelessness is the next one on your list. Homelessness is, again, all federal funding, and it's to us in the form of 2 grants. The bigger one of the 2, but still a small portion of money when we're talking about housing and prevention of homelessness, is our emergency services grant. We're essentially a pass-through for for this grant. We receive the money and then it goes out to the community-based organizations that really are handling and the experts in housing and homelessness. Additional money has been also received within this program throughout the last year and a half to deal with, I think we've all seen some housing crisis and ensuring people do not become homeless. Our low-income energy assistance program, and I'm going to tie this with weatherization, which is the last one on your list here in the document, because they typically go hand in hand. So our LEAP program really is 100% federal, no state general fund infused. And it's really to help our low-income families, our elderly, and our disabled with their current or unpaid utility bills. So if they are eligible, we make direct payments to the utility companies to assist with their bills. And really, we're helping them, ensure that they can be safe at home with all of the needed utilities that they need to do so. This has been another program in which we've had a large infusion of dollars through COVID. We've received dollars through CARES and through ARPA, and the amount in millions of dollars. Our first allotment has been expended. What these dollars did allow us to do is extend our season. LEAP season typically runs October. We accept applications beginning in October, and then we close applications in February. And that's typically because LEAP is most needed in Wyoming during the winter months. But because of the influx of dollars, we were able to extend our application. And then with COVID dollars paying for certain COVID cases, we've been able to do that year round through 2020 and so far through 2021. Weatherization, just tying it into that one, weatherization is a similar program in which it's 100% federal fund. It's a one-time benefit. So if you receive it once, you cannot receive it again. But essentially what we do is we have 2 contractors that we work with across the state who will go in and look at somebody's home and find where it needs to be weatherized. And really the point behind this is really to make it more energy efficient. So do those improvements and then to reduce the reliance on LEAP or other benefits that they may need so that their home is really running in order when we're talking about energy and utility. The next one on your list that shows up right after LEAP is it's been titled Special Projects. We thought these were important to put in there. While they are not part of our standard budget and they are not part of our standard programs, they are new programs that have been given and handed down by the federal government during this last year and a half. And as of right now, they may continue. We don't know that they will be permanent, but we will have them for a few years. So we thought we would let you know about them. I think the first one you hopefully have heard about, which is the Emergency Rental Assistance Program. This is a program that we have been partnering with a lot of other agencies on, Department of Workforce Services being one of our major partner on this, but we have also worked with the State Auditor's Office, ETS, Public Service Commission, amongst other state agencies to really get this program up and running. This is a brand new program that the department worked with all the other agencies to stand up a solution for. And really what it is, it's helping pay rental and utility assistance to the families. It's an income-based and they have to meet income requirements as well as, at this point in time, a COVID hardship, financial hardship, as well as housing instability. We did receive, and if you have seen something, we received $200 million in the first allotment. And that was really just a floor that the federal government decided on. It was not based on need. We don't have a need of $200 million in Wyoming, but we do have a need and we are working through that. At this point in time, we have approved $5.3 million in assistance and we'll continue to work through that program as well. Another new program that kind of is very similar to what we just talked about with LEAP is called the Low Income Household Water Assistance Program. So it will run and essentially function the same as LEAP does and follow the same income requirements and other eligibility requirements. But what we are now allowed to do through this program is assist families who need help paying their water bill. So this is brand new. We don't have the program technology or any of that set up. So we're in the middle of working through that now. And the hopes is that we will put live this program when we go live with LEAP in either October or November. And then the final one we have on the list for you is TANF again, but it's TANF in a different sense. So the TANF block grant is a very large federal block grant. Part of that, a very small portion actually of that goes to cash assistance, around $3 million of the block grant. It's an $18.6 million grant per year. The rest of those dollars go to what we call support services or community-based service grants. So the remaining of those dollars, when Director Cooley talks about the Dads Making a Difference program, dollars from this TANF dollars from here go to help fund that program. But they also go out to different communities across the state who are helping to work with TANF eligible families and provide different services to help them become more self-sufficient and self-sustainable. You'll see on the list a few examples: our home visitation, TANF preschool, and one of the bigger ones is work training. And so I know I probably went very quickly through a lot of these different programs, but I'm happy to answer any questions. I'm happy to answer questions just on the actual programs or any of the data that you see in the tables on page 4 or 5.
Questions for Ms. Arneson? I guess not. Must have low blood sugar waiting lunch.
Okay.
Thank you so much. That was excellent.
Thank you very much.
Okay. Department of Health. with poor Department of Revenues, actually, let me, because Department of Health is so accustomed to hanging with us. Is there, Ms. Henson, is she on? Let's let the poor lady dispense with us and go away. And Katie, was Jeremiah Reman wanting to testify? Not on, okay, all right. Brenda. We can't hear you, Brenda. And you're very small. Brenda, check your mic. You might be on mute. Oh. There you are. Oh. There you went. It's just, I know yours is long where I plugged it in, but I bet probably easier to dispense with it. Hello, can you, nope. I just have to keep happening. I feel so much happier seeing her bigger. All right, go ahead, Stefan. Probably he was there plotting, trying to make Mrs. Henson go smaller.
Thank you, Madam Chairman, members of the committee. Again, Stephen Johansson with the Health Department. I think this will be quicker than you think, actually.
Oh, that'd be good. What does your picture, or which, I thought I had them all lined up here.
Our presentation here begins on slide number 19 of
Okay.
the macro slide deck.
Hang on one second. Found it. Newspapers. What, page 19? Got it. Okay. Are we all there? It's in that packet that had the rate rebasing and state hospital, all that sort of stuff. Except for the stapled backwards feature. but- Okay, how are we doing? Still see flipping. Mostly there. Go ahead. We'll let other people catch up.
Thank you, Madam Chairman. So on slide number 19, you can see it's similar to what Director Cooley mentioned in her presentation. In our conversations with the two chairmen of this committee, kind of a working definition of what safety net meant were programs in the Department of Health that provide funding or services predominantly to low-income people or disabled people. And secondly, are paid for mostly, not totally, but mostly by state general funds. A couple of caveats that I want to make, because obviously the health department is always the 800-pound gorilla in the room with our size and our budget. A few things that are excluded from this sort of working definition and discussion. We did not include population health or public health programs for the purposes of this conversation, for the reason that they're largely allocated on a population health basis or largely funded with federal or other funds. Secondly, what you'll notice in this discussion is we did not include anything in the Medicaid program. And that was at the direction of the two chairmen, but also because those are generally 50-50, 50% state funds, 50% federal funds. But I wanted to caveat that because when we think of safety net and when you hear the word safety net, Medicaid probably meets that definition more than any other program for extremely low income people. Or if you think of optional programs like services for those with developmental disabilities or our long-term care waiver or children's mental health waiver, I think that would fit in a lot of our minds of what a true safety net is. But again, on the funding side, it's largely 50-50 state and federal. So it's excluded from this presentation. However, two things that would refer the committee to outside of this, per Chairman Wilson's comments, that often when you're in session or on the floor and things come up and you might not know about a certain program that's being discussed for funding purposes, Our Medicaid 101 presentation, I think, can be very helpful. We've provided that to the committee at trying to be a resource document for you. And in addition to that, for the past 8 or 9 years, the Department of Health has provided this committee and the legislature and the governor's office with what we call our health stat reports. And we give that to you updated every January. So usually before the legislative session commences. That is has a 2-pager on every one of the department's 65 or 70 programs. So about a 250-page document, light weekend reading if you're interested. But it really provides a snapshot of each program, a description, all of the funding, the state staffing that goes into that, and then a performance report on each program. So what is the program trying to achieve? What's its core purpose? And then its value chain. So what does it buy? What does it produce? What does it deliver as its outputs? And what is it trying to accomplish? What are its outcomes that we've listed? So it's a really good reference document that's, again, kind of outside of this discussion, but if you're interested, happy to provide that to you in hard or electronic copy, but we'll update you for fiscal year 21 with a new report in our health stat programs in January of 22.
I would just say it is a really interesting document. The one I have is in the 3-ring binder. I'm not sure if they all come that way, but I think when you start reading it, be prepared with a lot of Post-its and ready to bend down corners and a marking pen, because I have been kind to them and not asked them every question that ever came to my mind reading it, but it is very interesting. Go ahead, Stefan.
Madam Chairman, members of the committee, starting on slide 20, and I'll be brief with these descriptions. What met this sort of working definition when we were discussing this with the 2 chairmen were the following programs, starting with mental health and substance abuse. Like we discussed at length yesterday, these are largely general fund services with a peppering of federal and other funds for sure, but largely general fund that allow us to fund outpatient and residential mental health and substance abuse services in our communities. Secondly, on slide 20, you'll see the Wyoming Senior Services Board. And this is kind of a large category that has a bunch of different programs in it, generally funded through senior centers across the state, but provides access to things like congregate meals, nutrition programs, various activities, and other support services through the senior centers. Again, it's largely general fund, and eligibility is for any Wyoming resident, elderly Wyoming resident over the age of 60.
Hey, wait a minute. We mean elderly over the age of 60.
Mean that with no, made without comment. Madam Chairman, on slide 21, again, similarly delivered through our senior center network in most cases. The Wyoming Home Services Program is a 100% general fund program that provides in-home services for older and disabled residents in Wyoming who are potentially at risk of going into a nursing home. This program has been discussed a lot in the past several years as it was slated for budget reductions, and in fact, in the last session slated for elimination, which did not happen. And but again, meets this what we're calling a safety net definition by nature of being largely generally funded. I will say that these services and this idea is very similar to what's provided on a larger scale through our Medicaid long-term care waiver. So folks who would qualify for nursing home level of care through Medicaid and meet the financial qualifications of Medicaid, we're able to deliver those services on a homing or community-based level of care. This is just a little bit different, operates through our aging division, but it's kind of the same idea. Community and in-home services to prevent folks from going to a nursing home. Next, Madam Chairman, the tax refund program for the elderly and disabled. This was, we discussed this a lot with the 2 chairmen. I think it's come up numerous times over the past several years. This is no longer in the Department of Health, but used to be operated by the Department of Health for years and years, which was really a cash program for certain elderly and disabled folks that qualified. Very similar to some of the other property tax refund programs that we have around the state that are operated by the Department of Revenue and have various income and kind of social qualifications. But this program was years ago defunded at the Department of Health. And then ultimately, when discussion came back a couple of years ago at the legislature to bring it back, it was brought back, but ultimately moved over to the Department of Revenue. And you'll see that in the data that we'll discuss here shortly. On slide 22, Madam Chairman, this is I believe the only Medicaid related program that we have on this list, just because it is operated in the same division as Medicaid. This is the medication donation program. This is really an unrecognized gem of a program in the Department of Health that collects donated medication, unused medication. And we have a licensed pharmacy that operates in the basement of the Hathaway building that collects, verifies, and then can distribute that medication out to individuals who may not be able to afford it, who may be at facilities that the facility can benefit from that type of medication dispensing, and really has a huge return on investment to the state, not to the department, but to the state, with collecting medications and dispensing them at much lower cost to the individual. We do have eligibility standards in this program. Generally, it's 200% of the federal poverty level, but there are exceptions that we make on a case-by-case basis. You must be a Wyoming resident and basically lack prescription drug coverage to some degree. And next, Madam Chairman, we get into our 5 direct care facilities. Won't go into too much detail here. I think everybody on the committee is familiar with the mission of all of these facilities. But we have our facilities on the list because these are really generally our institutions and places where folks are being served because they're not able to be served out in the private sector for a variety of reasons. The first is the Wyoming State Hospital. We obviously provide psychiatric services on an inpatient basis, but also on an outpatient basis under Title VII. So it's important to remember we have a civil wing of the state hospital for civil commitments and a forensic wing of the state hospital for forensic evaluations and patients who are deemed by the court not guilty by reason of mental illness. On slide 24, Madam Chairman, the Life Resource Center we discussed at length earlier this morning. I won't spend a lot of time on this, but it provides intermediate care to folks with intellectual disabilities and significant behavioral issues. As we discussed, we are adding a skilled nursing level of care through the capital construction project, which will come online in the early part of 2022. Next is the Wyoming Retirement Center in Basin. Provides long-term care. It's a skilled nursing facility. Provides long-term care services in Basin to residents of Wyoming. Kind of runs a gamut of acuity there, from very high levels of care, locked dementia units, and down that spectrum as well. And finally, on slide 25, you'll see the Wyoming Pioneer Home, which is an assisted living facility in Thermopolis. And the Wyoming Veterans Home, which is in military speak called the domiciliary, but basically an assisted living facility level of care available to veterans in Wyoming. And in 2022, you guys got very capital construction heavy with the Department of Health over the past couple of years, and we will be opening a new veteran skilled nursing facility on the campus in Buffalo that's under construction right now, on time, on budget. We anticipate that being completed in June of next year. Madam Chairman, on slide 26 and on slide 27, you'll see all of those programs listed out on slide 26 by their general fund and other fund expenditures on a biennial basis. And then on slide 27, exactly the same layout, but in the annual average count of people served. So there were a few questions when we were talking about the mental health reform bill yesterday of how many people are served on an annual basis or on a biennial basis. And Representative Conaway, I believe it was you raising that. So you'll see on the first row on slide 27, the number of people served in the mental health and substance abuse programs there. So Madam Chairman, that was a 30,000-mile-an-hour overview. Happy to answer any questions.
Good job, Representative Flitner.
Thank you, Madam Chairman and Director. Thank you. Regarding the skilled nursing facility in Buffalo, have you begun seeking staff for that facility? I know at the time when we discussed placing it there, that there was concerns about staffing. Of course, that was pre-COVID, long before pre-COVID. So just curious on staffing, any concerns? How goes that?
Madam Chairman, Representative Flintner, it's about a $5.6 million question, so thank you for asking it. We are preparing that in our budget request. We basically need the positions to staff that facility, which was anticipated in the planning and in developing this facility. Once we have that decision in the next legislative session, and whether those positions are authorized, funded, effective immediately, we'll be able, depending on that timeline, to start recruiting to fill those positions. To your point, it will be a challenge, just like it is at all of the locations that our Department of Health facilities exist, to staff them and staff them adequately. I'm optimistic that we can do it, and we can fill that facility up to its capacity over the first 2 years of its operation, as was planned, kind of a scale up depending on when we're able to staff it. I also should mention that with the Veterans Home, it's a bit of a unique financing mechanism where, as you may recall, the legislature ended up giving the Department of Health a loan from the Treasury Department to finance the construction and the initial operations of that facility, which could be used to satisfy the department's upcoming budget request for the positions and staff. So there's kind of a decision: do you front load the general fund for those positions, or do you access that loan? The reason I bring that up is, over the long term of that facility's operation, it's been designed in a way that should be cash flow positive if we hit our mission. Because of what we can leverage from the VA and from Medicaid rates for skilled nursing care in a state-owned nursing home, we should be able to, number one, offer relatively competitive rates for veterans who might have some ability to pay on a self-pay basis. So a little bit cheaper than some of the private sector alternatives, but also leverage the federal funds through Medicaid and the VA to make the facility cash flow positive. And over the long term, similar to how we operate at Basin Nursing Home, should be general fund neutral, should be no general fund subsidy.
Questions for Representative Connolly?
Thank you, Madam Chair. Director Johansson, is there any of these programs that are either specifically for accommodate people with Alzheimer's or dementia?
Madam Chairman, Representative Connolly, I wouldn't say specifically just for that group, but through our aging division programs, a lot of those services are geared either on the preventive side or on the support service side for folks with those cognitive issues. Yes.
Just follow up
Follow-up,
with residential. I'm kind of looking to see if the Pioneer Home or the Retirement Center accommodate people with those kinds of issues.
Madam Chairman, Representative Connolly, yes, they do. We have a dementia unit at the retirement center in Basin. We will also have that level of care in the new skilled nursing facility in Lander for folks that, in addition to other comorbidities on the mental health side, may suffer from that as well.
Questions? Further questions? Great. Thank you very much. Okay, and then have we got Director Hanson word lined up?
Test.
Well, hello, we could hear you.
Ah, there we go. Hello from Cheyenne.
Welcome to the Labor Committee. I think this might be the first time you ever came to the Labor Committee.
I believe you are correct. Madam Chairman Brenda Henson, previously known as Brenda Arnold. I really appreciate the opportunity to cover our one program that we've got at the Department of Revenue, the Property Tax Refund Program. And again, good afternoon, members of the committee as well. I am currently the director of the Department of Revenue, came on August 2nd, so I appreciate this chance to address the committee. The Property Tax Refund Program is a system by which property owners can apply to either the county treasurer or the Department of Revenue. They have to have timely paid their taxes. It provides them with up to 1/2 of their property tax payments refunded back to them. And it's to a point, this program, what's unique about it is that it actually, our qualifiers are calculated based on each county. As you can imagine, the income and the value of homes in the various counties across Wyoming are different. So this program, I'll give you a couple of examples. For Niobrara County, the median property tax bill, half of that would be $239.67, as opposed to Teton County, where the median property tax bill is $2,556.45. Also on the income levels, for Niobrara County, the median, 3/4 of the median income calculated to $35,415. Now that would have been one of the counties that then that income qualifier, you could actually use the 3/4 of the statewide average. So as long as they meet the income criteria of $47,865 or less. Teton County, that median income number was $71,678. Now, the numbers that I'm sharing with you today were the numbers calculated for the 2019 property tax refund amount. The program was funded for the refunds for 19 and for 20. But as you mentioned earlier, Chairman Wilson, we did see some programs that are funded by the State General Fund that were eliminated, and this program is one of those. We basically reverted approximately $247,000 of what was remaining of the $1 million that was budgeted for the 2019 refunds. And then we reverted the entire $1 million that had been appropriated for the refunding of 2020 property taxes. This program typically saw applicants anywhere from 2,500 applicants to last year we saw the 1,411 applicants that qualified for the program. This is a somewhat unique program in that you do have to own the property, have to have timely paid your taxes, but there's no age requirement on this. Basically, when it was put into place, it was in recognition of sometimes families may need assistance one year, but perhaps not the next. And so it is a yearly program. We also had to ask for an appropriation to update our actual system that we track and grant the refunds. In addition, I wanted to cover just briefly that as mentioned by the Department of Health, the statutes moved the tax refund for the elderly and disabled to the Department of Revenue, but it has not been funded since those statutory changes were made. And in addition, we've not received an appropriation to develop the programming that would administer that system. So with that, I've also provided the committee with the historical numbers showing, and I'll just refer to that 2019 tax year. Again, 1,411 applicants that were approved. That was at a cost of $752,320. The average refund on that was about $533 for those applicants, but you can actually see where that program, where property owners took advantage of that within each county. With that, Madam Chairman, I would stand for any questions.
So Director Henson, did I understand you to say that for 2020, there is no appropriation?
Madam Chairman, that is correct. It was appropriated during our original budget request, but during the COVID-19 reductions, those funds were taken away.
Okay, thank you. Questions for Director Henson? I guess not. Okay, thank you. Thank you very much. So committee, I hope that was a lot of information. I bet there were a lot of things there that you didn't know existed. But what I'm kind of thinking of doing, if you think it would be helpful, is to ask LSO very kindly to condense all the agencies into one document, maybe a little bit smaller, but, and all in the same format, so all the years go in the same direction, and, you know, that the, so that the presentation is the same for everything, and just have it be something that we can send around electronically. And if you think helpful to all members, I just feel like it was a good summary from my point of view anyway. Okay, thank you all there. Now I have a question for those out in the audience there. We have, well, hold on, let me get my agenda here. All right, so on the agenda, we have the Pharmacy Services Follow-up, which was the Scope of Practice Act, which I believe, although I'm often shown wrong, that it is a relatively small, uncontroversial bill. But what I want to know is, because also people are probably hungry, is there anyone in the audience who is only here for the Scope of Practice Act bill and will then go away? Two of you. Three of you. Committee, I think we could be, I would love to be really courteous and knock this bill off rapidly so that they don't have to sit around for another hour and a half. Can we do that? Okay. Who we got to present the bill? Is it the pharmacy board or John, or what do we got? Nobody.
Madam Chairman, the language was proposed by the pharmacy board, but I'm more than willing to walk through the bill.
It looks like Mr. Martineau is here.
Whatever the chairman would prefer, it's really.
Which of you is faster? That's what I was thinking, actually. Mr. Brody, would you mind just presenting it for us? And committee, we did see this in June. I don't think, I do see there's a few staff comments, but really, I hope that we can just knock this off and at least send 3 people home.
Thank you, Madam Chairman. John Brody, Legislative Service Office. So the committee may recall that this was a request that was submitted to LSO at the June meeting. This bill does just a couple small tweaks. The first thing that it does is it sort of alters the supervision requirements that are in the Pharmacy Act. It kind of gets rid of this idea of direct supervision and instead just goes to a straight term of quote supervision. It also gets rid of the definition of direct supervision. So I think what would probably occur, and I don't want to speak to the board, but they may, through regulation there, define what supervision is for the purposes, you know, of the profession and what would be required. Separate from that, and there's a number of, so maybe I'll go a little more logical, but so if you go on to page 2, that's kind of where you're going to see all these references to direct that are being stricken. Through page 2 onto page 3. On page 3 is sort of the more substantive part of the bill. And what this does is acknowledge that a pharmacy technician or pharmacy intern is able to administer immunizations under the supervision of a pharmacist. Basically just in line with their training. I would note that we included a comment there with respect to the sort of exception as to whether or not they would have to administer an immunization to somebody under 13 years of age. That language is identical to the, I guess, exception that's provided to pharmacists. So it's really a policy decision for the committee on whether or not they want to keep that same type of language, have a different type of exception, or have an exception at all. Just, I guess, as a reminder to the committee, there was a kind of similar exception in the proposed language that was offered by the board. However, working with the board, it was modified a bit. So that's why we ended up with the language that is in the bill now. Moving on to page 4, again, we're just doing conforming amendments to strike this idea of direct supervision. Moving to section 2, these are the definitions of direct supervision that are going to be repealed through this bill. The comment just simply offers substance to what those definitions are. They're similar but not identical. Just wanted to point that out. And then sections 3 and 4 of the bill is just a split effective date. You've seen these many times before. We just afford the board some time to promulgate rules before the effective date of the bill. which is July 1st, 2022. Happy to answer any questions.
Okay, questions for Mr. Brody? Okay, Mr. Martineau, have you got any comments?
Madam Chairman, Matt Martineau with the State Board of Pharmacy. Thank you again for considering this bill, and just here to speak in support of it and answer any questions that you may have. Again, as far as removing the reference to direct supervision, the board is hoping to get to where it can regulate the practice of pharmacy as it's happening nationally. There's kind of a catch-22 as it is in the statute right now, where direct supervision is required of pharmacy technicians are allowed to do functions that require direct supervision, but then they're also allowed to do some things that don't require the professional judgment of the pharmacist. And so it kind of becomes a, well, what are the functions that they can do that don't require direct supervision, and what are? So by removing that, it allows the board to better promulgate rules as far as what are the things that do require pharmacists to be there directly, and what are the things that maybe technology can assist the technician with, like when they're restocking an automatic dispensing device in a hospital or something along those lines. And then two, what we've seen at this point in time, now that we have more technicians who have undergone training and are able to provide and administer immunizations in Wyoming. So the board is hopeful to be able to keep that workforce mobilized and be able to have so we avoid a situation where things go back to the way they were before, and all of a sudden there's bottlenecks and problems back in the pharmacist workflow where it's only the pharmacist or an intern who may be there that can administer the immunization.
Questions for Mr. Martineau? Senator Baldwin.
Thank you, Madam Chairman. Just remind me, because June is a really long time ago, the training that person in the pharmacy will receive to give immunizations.
Mr. Martineau.
Chairman Wilson, Chairman Baldwin, the training, the way it's outlined right now in the PrEP Act is that it has to be an ACPE accredited training course, and there's a number of different programs available that do that. The Pharmacy Technician Certification Board is the entity that provides the licensing exam for technicians, and they've developed an accredited training program that will grant a certificate to them. We've had discussion with different universities about how they can help to provide that training as well and make sure that the technicians are doing it. So far, it's the same training that an intern receives while they're in pharmacy school. It's a 12 credit hour course that they would ultimately take and complete.
Okay, more questions for Mr. Martineau? Okay, thank you. Any other testimony on this bill?
Madam Chairman, if I could, I just wanted to offer one clarification that in my very brief overview, maybe it was worth noting. We did create that exception within the ability for pharmacy technicians and pharmacy interns, or excuse me, pharmacy technicians to administer the immunization. That exception only applies to the technician and does not apply to the pharmacy intern. Through discussions with the board, my understanding was that that would or could interfere with the circumstances of the intern's training. And that is the justification for why there's that distinction in the bill.
But so this is specific, I mean, we are not, we weren't contemplating bringing in interns anyway, as far as I know. Mr. Martin.
Madam Chairman, on page 3 on line 14, it does include pharmacy interns as far as specifying in statute that interns are allowed to administer vaccinations under the supervision of a pharmacist. Previously, the board had promulgated rules and interns are allowed to do it, but our advising attorney general felt it would be best to approach the legislature and have that clearly spelled out and included in statute that interns can administer vaccines under supervision.
So then to clarify, so Mr. Brody, I'm not sure whether I understood. Were you saying that maybe we don't want the interns in here because it might interfere with their training, or that we?
Well, no, I feel in my brevity that I maybe not have touched on that fact that they're not only is it pharmacy techs, but it's also the pharmacy interns. And then kind of a subclass point to make is that the exception for, those under 13 that you don't have to provide that immunization, that only applies to pharmacy technicians. Because in conversations with the board, the understanding was that pharmacy interns through their training are going to be, or likely going to be in circumstances where they may be in that situation where the exception is going to interfere with their training. So the exception doesn't apply to pharmacy.
Am I clearly understanding, Mr. Brody? Or I feel, I'm not, okay, that's good. Fine. And if, actually, Mr. Brody, I'm not sure that you were here for the committee. Actually, you might remember. Were you here when we passed the vaccination authorization for pharmacists to vaccinate?
I believe so.
My recollection then, and actually Mr. Martineau probably knows, is this in here from the whole pharmacy, under 13 dating back to there when we, and maybe I'm wrong, but when we authorized about 8 years ago, pharmacists to give vaccinations, there was discussion among the kinds of pharmacists. Some of the pharmacists who had been practicing for longer felt that they had not received adequate training in pharmacy school and didn't want their, let's say, national chain grocery store to mandate that they had to give them to minors when they felt that they were concerned that they wouldn't be prepared. And so am I remembering correctly that this might be dating to that, or is that not that issue? It is that. Okay, I'm seeing that. Okay, very good. Okay, any other questions for, let's see, we already cleared that up. Is there anyone else who wants to testify? Ms. Carroll, come on up.
Committee, I am Melinda Carroll. I'm here representing the Wyoming Pharmacy Association. I just wanted to let the committee know that the pharmacists in Wyoming are supportive of this. As we all know, we administer a large number of vaccines in the pharmacy, and having this additional help will ensure that the pharmacists are freed up to talk to their patients to provide true patient care and alleviate some of the strain that has been put on pharmacies very recently with the COVID vaccination effort that has been ongoing, now going into the flu vaccination effort. So I just wanted to let you know that, yes, the pharmacists and the Pharmacy Association do support this.
Good. Questions for Ms. Carroll? Okay, any more comments, public comments on this bill? No, then do I hear public comment is closed? Do I hear a motion on the bill?
Motion.
Moved by Baldwin, seconded by, I think, was that Bouchard? Okay, and is there any, whoever, seconded by a lot of people. Is there any discussion on the bill? Then will you call the roll, please, for to sponsor the bill?
Madam Chairman, this is on 22 LSO 0082, pharmacists and pharmacy technicians.
0082.
82.
Wait.
82, yes.
Okay, I didn't hear you clearly. Just making sure.
Senator Bouchard.
Aye.
Senator Furby.
Aye.
Senator Hutchins. Senator McEwen.
Aye.
Representative Clifford. Excused. Representative Conley. Representative Flinton.
Aye.
Representative Hallinan.
Aye.
Representative Ottman.
Aye.
Representative Romero Martinez.
Aye.
Representative Stivar.
Aye.
Representative Wharf. He left a proxy. Aye. Co-Chairman Baldwin.
Aye.
Co-Chairman Wilson.
Aye.
Bill has been adopted. Or
Okay.
sponsored.
Very good. All right. So you three can fly freely as birds. The rest of us will go to lunch and come back at 1:45. 1:45, back promptly. It'll actually only be 45 minutes late. That won't be too bad. Moving right along. Those of you who just showed up, there is that nice cafeteria downstairs. And then we will take up the pharmacy benefit manager products. 1:45. Yes, you may. Thank you.